for joining us, whether you're here in person or on the virtual platform. My name is Meg Olson, and I work with Immunize Oregon to manage the Advocacy Committee. I know most of you have been I've got our special guest here today who we were not expecting.
Oh, me.
Yes, you.
Yeah, sorry.
Jessica, and so she is going to start us off by talking a little bit about what Immunize Oregon is, and then I will go into a little bit about what today is going to be.
Let me take that one, actually.
Okay.
I'm not sure if that's on.
Is this one working?
Okay, so my name is Jessica Coleman. I am the program manager for Immunize Oregon, and you probably are wondering, what am I doing here? I'm insane, and I felt like I wanted to be here today because this is very important. Why?
I don't know.
Why? Okay, now can you hear me? Did you hear anything I said? Okay, it's not that big of a room. I feel like you guys can probably hear me. All right, so very excited for you all to be here today and be a part of this conversation. It's something that we've been putting together for a while now, and we also think that like policy and advocacy is an area that we really wanted to branch out into as Immunize Oregon's coalition, because it is so impactful to our communities that don't have access to vaccinations out there, and there's a lot of vaccine hesitancy. And so we love that you guys are all here today and can help with this conversation so we know which direction we need to be going in the future. So Immunize Oregon, who are we? We are a statewide coalition dedicated to enhancing vaccine confidence across the state. We are state funded, so we get all of our funding through grants. And we are housed within a legacy health system, so it's a hospital system in the area. And so we have kind of the best of both worlds. We have some of the government health access as well as some of the clinical side as well. And I'll kind of go into some of the organizational structure there so you kind of understand. But it is always very confusing when people ask if we work at Legacy or Immunize Oregon. It's a program within the hospital that is funded by the state. So I know that's a lot to take on. No? Still can't? I got to talk here? Okay. All right, I got to swallow this thing apparently. It's just for you guys to hear me. All right, so here's our mission, our vision. Main thing is our role is to advise health professionals, policymakers, parents, and the community on the current science and best practices regarding immunizations. Basically, we bring the community to the table and they tell us what is needed in their communities so we can better support and collaborate across the state. So we're not duplicating work, we're not utilizing resources, we're kind of maxing out as much as we can so we can make sure that everything is happening effectively across the state. And all of our partners are being boosted as we're moving through trying to get vaccinations out there. Back in like 2018, we merged with the HPV Prevention Alliance, and they are with the American Cancer Society, was their lead agency at the time. And so we decided that we would collaborate together. So we'd have two coalitions kind of simultaneously, now three, which I think you'll probably jump into. So we have those two organizations working simultaneously, even though because we have a lot of the same target audience and we have a lot of same goals and objectives that we want to achieve. Theirs is just specifically around cancer prevention, which is a very different conversation than we have to have with parents in the community. So it's slightly different, but still very important stuff. So kind of the organizational structure, we have our two coalitions working simultaneously, now three, need to add that one. So the coordinator and the manager, we are a staff of two. I know it seems like there's a huge team, but that's because we have great volunteers that support us in all of this work that we're doing, that join one of these main committees, as well as the leadership committee as well. So we have a leadership committee for both sides, just because the conversation is slightly different and the goals are different. But we work together collaboratively to make sure that we aren't duplicating our work across the board. All right, that's me. That's Molly. There's a third one coming. She's on her way any second now. So if I have to run out of here, that's probably why. But yes, we are a team of two. And then for leadership, we have, so our committees, we have about 2 hours a month that we kind of have them commit. Meeting virtually, letting us know from different sectors what's going on in their world so we can all stay informed on what's happening and that we can move effectively across the state to make sure that the work is being done as we need to. All right, so after this, we have our online community that we have been building out for the last year. It's intended to be kind of a clearinghouse of information as well as collaborative effort workspace, kind of like the Whova app today. It's just bigger. So it allows more people to be in the space. It is a select amount of people that can be in it. So we make sure that it's kind of filtered so it's not just anybody can join, so that it's kind of a secure space for health professionals and policymakers to work together so that it's not getting ridiculed by the work that you're doing that's not quite done yet, or taking words that you say out of context and throwing it on Twitter or X or whatever you're calling it these days. So it allows for a lot of collaboration here. And we want to make sure that all of you have access to it because we also put a lot of events happening across the nation. We put a lot of like resources that are brand new and posted. Any news that comes from the CDC gets directly dropped in there. And then it sends out this nice, pretty little listserv insight each week. So you get like the basic updates. So it's a great way to stay involved and stay informed of what's happening across the state and the US. All right, so one way you all can get involved, we gave you a bunch of stickers and tattoos. It's one of our ways that for the flu season, we call immunity influencers. So we want to make sure that you guys are influencing people to get vaccinated. And one way to do that is put a tattoo on after you get your flu vaccination. Just do a little flex your defense. Send us a photo, and we can post it, or you can just post it yourself. But we want to change the social norm around vaccination so that it's not so much this like kind of strict conversation where people are just kind of weird about it. We want it to be a social norm so that people see kind of routinely in their day. So it's mainly just kind of planting that seed each time that this is something that our community wants to do and really holds value in. All right, then what's next? You don't have to be as extra as I am and do a Rosie the Riveter photo, but that would be awesome if you did. Join the community, that's the main one. Like, it's just a great way to really connect with and vaccine confidence. We have all of our community webinars on there, so check our calendar. Even if you're not joining, the calendar is open to the community, so you can see what virtual in-person events are happening that you can tune in on. And then we have our next coalition in November 7th, which will be, we bring in experts to kind of talk about stuff and make sure that it's relevant to what's happening. So with RSV and the COVID vaccine and everything else that's coming down the line, or whatever this thrown into us this season, we can have that opportunity to connect and have more information just kind of constantly flowing. All right, so I'm going to talk about the app. Many of you may have gotten this email already, so I want to make sure that we kind of go over it because we will be utilizing it a lot today. And it's mainly because it allows us to really connect fast and make sure that we can make the day run smoothly. So first, if you want to scan the QR code, if you haven't, there is a code right here in case you were unable to get to it. If you're going to be joining from the website, make sure you turn the sound on your computer off first before you jump in there because it will live stream you. And then I have to hear myself talk, and that's really weird. So please turn that off. So from the live chat function, that's where you can chat with the organizers, you can chat with people in the room, kind of thing. It's a great communication tool that we use for the hosts and the speakers. There's also an ask and vote of questions. I'll show you the buttons as we get to it. So that you can ask the questions to the speakers and we can quickly move through some of those because we have a pretty packed agenda today. So we want to make sure that we're flowing through pretty effectively. And then there's discussion boards that you can join. So if there's specific things you want to ask fellow attendees, feel free to do that as well. Just like best practices, how do you address this question that parents bring in, things like that. It's a great opportunity to kind of post some of those concerns or questions that you're having overall in your work. So does this point?
No.
Oh, yeah. Okay. So from here, you can see on the website, there's a session app. So you'll go to the agenda and show the agenda item. I think it pulls out, doesn't it? Like when you click on this, so it comes out the video stream. So the video stream will come out, but you're in person, so you don't need to video stream it. You're seeing it right now. So the Q&A session right here, you can vote up questions. So if someone's already asked your question, vote it up so we can get to those ones first and make sure that we have enough time for the questions that are really important for you all. The chat is right there, so you can just like chat away if you want to, make little comments. It's like, this is great, I love this place. And then there's the community piece here where all the discussion boards are. And same thing over here, session Q&A on your phone, the chat function and the vote up, and you can ask your question right there. All right, experts on HUVA? Yeah? Okay, the silence is really great. Really confident in that one. So at the end of today, we want to be an Immunize Oregon event if we didn't raffle off stuff. And of course, we are known for our Pendleton blankets, and that's what we raffle off today. So you have to be present to win. You can't just dip out early. You got to be here for it. So it's making you all stick around for a little bit longer. And we will do a virtual session one and as well as an in-person one. So someone in person will win and someone virtual will win. So it's fair. I want to make sure we're equitable. And then here's all our information to contact us. But don't contact us. Just go to the community, which is right there. All right. Do you want to introduce the?
Yeah.
This for you.
Oh, thank you. So in a minute, we'll have our first panel come up and start the very first presentation of the day. We have some really amazing speakers for you today to talk about some of the issues that they're seeing in the field, what we're seeing across the state, and how we can effectively advocate for solutions. After lunch, we will have our legislative panel to talk about their priorities and kind of the landscape that's out there. We will have some virtual speakers for that panel. Obviously, please bear with us. This is a hybrid event, so there will be some, as we go about these panels or these presentations, we'll probably repeat questions out loud in order for the online audience to hear them. So the goal for today, after the legislative panel, we are hoping to start our work session and then a couple breakouts. The goal for today is really to take what we learn and what we hear from our presenters and what they're telling us from their very specific backgrounds. Sorry, most of you are over here throwing me off. And come out of it with a direction for policy development and for our advocacy committee overall. So I am going to, sorry, I'm actually going to get our speakers all set up with their mics. You'll see anyone who's up here speaking has 2 microphones. We're holding one, and then we have one pinned to us. And it's just so that we can get the audio to the streamer. So if you'll give us just a moment, we'll get our first panel up here, and then I will actually have Molly or Jessica come and introduce them.
Everyone for being here. We're very excited for our first panel. I'm pleased to introduce Dr. Hassan, Dr. Cohen, and Celeste Craven, who is a family nurse practitioner. And I'm going to turn it over to them. Who would like to go first with their
Are we
Go
just
down the
introducing
line.
ourselves?
Yeah.
Oh, okay.
Um, Yes, if you would say,
sounds
if
good.
you do a short introduction, that would be fine.
Hi, good morning. I'm Max Cohen. I'm a naturopathic physician. I work in primary care at Neighborhood Health Center at their Oregon City Clinic, seeing underserved populations there. And I've been volunteering with Boost Oregon, doing immunization advocacy and education since 2018,
17, I think.
17.
Yeah.
Yeah, so longer than I can remember, I guess. And well,
My name is Celeste Craven. I'm a family nurse practitioner. I work at Neighborhood Health Center, the same with Dr. Cohen here. I work as a primary care provider in a family practice about 50% of the time, and the other time I am very fortunate to run a school-based health center in the Beaverton School District. So I work with a lot of primarily teens at the school-based health center, and then in primary practice, I work with people of all ages as well as providing HIV care.
And I'm Dr. Ryan Hassan. I'm a pediatrician. I work at Oregon Pediatrics in Happy Valley 3 days a week. And 2 days a week, I work as medical director of Boost Oregon, the nonprofit Max and I both started volunteering with, I think in 2017. And I've been doing that role as medical director since January of last year. So in that role, I help with educating healthcare providers as well as people in the community about vaccines and creating curriculum for Boost Oregon. And then in my role as a clinician, a pediatrician, I see kids from birth to 18, sometimes early 20s, depending on if they don't want to leave. And do a lot of work on vaccine advocacy within the clinic as well as on a broader level. Back? Okay. All right.
We're so grateful to have these three different perspectives, all around obviously vaccine competence and access. Are there any questions in the room before we vote on the virtual attendees and higher discussion? Anyone have a question in the room? Start us off.
I was interested, thank you all for the work you're doing today. I was interested, I've heard some reports in the media that as kind of questions around the COVID vaccine led some folks to then kind of start to have more questions about the pediatric and other kind of childhood vaccinations. And then it seemed kind of a bleed over where once we started having hesitancy around the COVID vaccine, that's not going to be practice. So about the time where these kind of evolution last few years.
yeah, sure. Yeah, we've definitely been seeing changes in the attitudes, and prior to 2020, prior to the pandemic, I felt like oftentimes when people came in with questions, they were specific around a certain immunization or a certain thing they heard, and you could then engage around that conversation and give them information. Now, what I'm seeing and what I suspect you both are seeing as well is people are coming in with a lot more galvanized beliefs around immunization as a whole, and are not as oh, I'm sorry. I'm a soft talker, and apparently I wasn't holding this close enough. So let's try that again. So to paraphrase what I was saying earlier, is prior to the pandemic, concerns that I was seeing were more individualized and specific to an immunization or a question that was out there. And now, as we enter this new phase of normal, the questions become more pervasive, and people are coming in with very preset notions about immunizations that are harder to discuss because they are more vague and amorphous and about immunizations as a whole. And I think that speaks to kind of a loss of trust in the kind of the system at large, because there was a lot of confusing information and misinformation flying around over the last 2 and 3 years.
I think you answered it. I was a bedside nurse for a very long time before becoming a nurse practitioner. So I started my practice as a medical provider, as a nurse practitioner in 2020. So I, didn't have the opportunity to speak with parents and families about vaccines specifically before that time. But what I have noticed in my clinical practice, just to echo what Max is saying, is that if a family presents to me specific with concerns or questions about a COVID vaccine and then bleeds over into questions about other vaccines, there's kind of more often than not a lot of very, how do I say this in the right way? There's often a lot of protectiveness, a lot of defensiveness, and so how I approach those conversations is first with really acknowledging in an empathetic way that I understand that this is very scary for them and very confusing, and that, I really commend that they're coming to me to talk about it at all. And I think in general, in most of those situations, that sort of softens a little bit and allows for more of a conversation. But absolutely, when I encounter a parent and their, concerns about COVID vaccines and then having other questions about vaccines, I kind of know, okay, this is, I really have to spend time creating a very, very good therapeutic relationship about vaccine safety, and I'm here to listen to them actively before I even further into the conversation.
Great timing for starting, by the way. 2020 is the best time to get into medicine.
Yeah, I know. Well, I was in the ER, and then I transitioned out.
Yeah.
It was like,
So yeah, I think I've had several patients. There's a lot of patients I have who they want. Is that me? Okay. All right. Okay. All right. So there's a lot of patients I have who want to vaccinate with all the vaccines except COVID and have specific concerns about COVID. I do also, though, have patients who because of COVID, are very much against all vaccines. And in the last 2 weeks, I've had maybe 6 patients who have explicitly said, I used to vaccinate my kiddo, but now I don't. And I've had I try to get, explore as deeply as they will allow me to, kind of to understand where they're coming from. And some very open and honest conversations with people who tell me, yeah, if I could go back and do it over, I wouldn't have vaccinated my kiddo. Or if I have another kid, I'm not going. I have patients who do have new kids who are like, well, I vaccinated my other ones, we're not going to do it this time around. And when you try to explore why, it's, well, everything that happened with COVID, it's nothing specific. It's vagaries based on some very real earned mistrust from some poor handling of the pandemic on the part of the administration, the CDC, local health authorities, everyone acting in silos, and a dysfunctional public health and healthcare system. That's not at the fault of any individual per se, although we could certainly blame some. But it's a result of systemic inadequacy of our systems that aren't funded or designed to actually deal with this problem, and human failings that haven't been well acknowledged. And then there's this whole disinformation machine that already existed and capitalized on COVID to double their profits or more by taking advantage of, like, saying, well, look, the CDC is giving out this confusing messaging about masks, or, they made this statement about boosters that's not accurate. And now, what else can you not believe? And so it all gets tangled up into this jumbled mess of anxiety and fear that parents are kind of swimming in. And it's really hard because, kind of as you both alluded to, you can't really dive into a specific, well, I heard this, can we talk about that? It's more, I don't know why I don't really like them. I just don't trust any of these institutions, so why would I trust the vaccine? So yeah, I've seen a lot of that, and it's hard to have that conversation.
Thank you all, and thank you guys for the questions. Is there another question in the room?
Specifically regarding the flu vaccine, I have a lot of people, and I've had this experience where they get the vaccine and then they immediately get sick. And so the thought process is, what's the point if I'm going to get sick anyway? Are there talking points, reasons? I mean, is it about spreading it around that would be benefit? Or what do I say back?
Sure.
Yeah.
Hi, I get to go first this time.
Uh,
So I think I would say, I think, yeah, we're probably all going to say the same thing. I kind of, what both of you already said is like for any conversation about vaccines, the starting place is with motivational interviewing. You talk about listening to them, hearing their concern. I use a lot of reflecting statements. So they say, I don't like it because I took it and I got sick all the time, so I just don't take it anymore. And I wouldn't start by debunking that. I would start by saying, okay, you have had this experience where it just feels like it's not helping you, where you feel like you're maybe worse off after you get it, and just find a way to reflect what they're saying. And if they say any reasons they want to give it, like that's even better, like focus on that. But start by making sure they feel heard. I think there's lots of talking points, and I'll share a few, but the most important thing is knowing like you can have all the perfect zingers and say, well, this is why you're wrong, and it's not going to change people's minds. Humans are not computers. We don't make logical decisions. We're all irrational, emotional, fear-based decision makers, and that's me too. It's not no one special here. And so we have to start by engaging people on a human level. So if they are ready to hear, if I say, could I share my perspective? Would it be helpful to explore that more? And they want to hear some information. Ways I will address it are saying things like, well, when you get the flu vaccine, you cannot get the flu because of it. It's an inactivated vaccine if you get the shot. And it's, so you're not going to get sick, an infection because of it, but you could get like some mild side effects, like maybe fever, muscle aches, feeling a little crummy for a few days. But another reason, so sometimes people have that experience and say, well, I don't want that. But also a lot of times people just get sick because you get sick in the wintertime, and we always try to find a reason for everything that happens to us. And so if you get a shot and then get sick in the next few weeks, you're going to want to find something to blame it on. The shot's an easy thing to do, but you might not think about, well, also like, there is someone next to me on the bus who like sneezed and like maybe that got me sick too. So we easily attribute things to the shot, even though it might have nothing to do with it. We're always sick more in the wintertime than we are in the summertime, and we get the flu vaccine right at that transition. So it makes sense people are going to have this what we call negativity bias around it. I'll let y'all talk to some of the other points.
Perfect. No, I think that was really great. I will again echo a lot of those similar ideas there. And I am very direct if the, patient or family member is open to it and saying, you cannot, get sick from the flu vaccine. And I always start with, I'm going to say this as respectfully as possible, because your experience is your experience. And that it is, more than likely you were having a side effect from the vaccine when your immune system was really, starting to boost up from the vaccine, and you can feel kind of cruddy from that. So I'm really sorry you had that experience, or that you just happen to get sick at the same time. And those are very, very hard things to relay to folks at times. So those are usually my identical 3 points that I stick to. And if people are scared of the flu vaccine after that and they don't want to do it, then that's their prerogative. But those are usually just the 3 things that I stick to.
Going third has some disadvantages here because we all have pretty similar opinions around this. I will usually engage around that. I got sick after the flu vaccine, just around reminding people that we do get sick in the wintertime, you were saying, and because we give many people the flu vaccine, statistically on average, for no reason other than bad luck, someone is going to get sick after having received the vaccine. And some years that might be you, especially if you get it each year, and then some years you still get sick, whether or not it's actually influenza, which is another problem because colloquially we call everything the flu, right? So I got the flu after I got the flu shot. Oh, what happened? My ankle hurt. Okay. Right. So it's just hard to disambiguate that sometimes. And one thing I will lean on heavily, if it really is a flu vaccine specific concern around prevention, is to use a non-vaccine example. I lean into this all the time, as I imagine you guys do as well. I'll use statin medications to prevent cardiovascular issues. And I'll say that, if you start taking a statin when you're 45 because you have high cholesterol, and you don't have a heart attack in 20 years, how do you know that the statin was effective, right? Nothing happened. You didn't experience anything. Whereas if you don't do that, and then in 20 years you do have a negative outcome, right? We can't go back in time. And so if you get the flu vaccine and you still get sick, but you don't get as sick, or you don't have a bad outcome that otherwise might have happened, you won't experience that and you won't know that we prevented it, which is why prevention is so different than reacting to something that's happened.
Okay. This is, I think, primarily for Celeste and Ryan, since you guys seem to work more with the younger ages. And I'm a former educator. I worked in a middle school for a number of years. My understanding at that time was that Oregon was one of the highest levels of voluntary exemptions from vaccinations for children in the country. And I understand it's gotten worse since then, but I also understand that that is primarily the decision of adults for their children. What are the conversations you have with maybe your school-based health center or some of those not pediatric pediatrician patients of yours that you know, the 18, 20-year-olds? What are those conversations like, or maybe even 15-year-olds?
Directed you guys first. I do see kids, but you guys go.
I was really nervous about being presented with a question that I didn't know all the statistics around, so I'm just gonna start off with saying, I can't speak to, you know, the percentage of kids or anything of that that do not receive vaccine due to parental exemption, because unfortunately, I don't interact with those kids at the school-based health center, but I am very happy to answer this question. So at this, and I'm just gonna do a little bit of a background. So within school districts, there are mandatory vaccines for children, and they're not all encompassing. They don't encompass all recommended childhood vaccinations. So often what I see in the school-based health center, usually through vaccine events, are parents, guardians, adults who are bringing their children into the vaccine event to receive the required vaccine for continuance with school. So MMR or Hep A or polio or whatever that is. And those moments when I'm giving the vaccine or the nurse is giving the vaccine, I pull up the state registry and I at that time talk about, oh, you know, you can get a meningococcal, or it's you are eligible for an HPV. And so that's when I have those conversations about some of those other vaccines. And generally, if I can build rapport with the family pretty quickly, most families are agreeable to getting those additional vaccines in those moments. But other than that, I do encounter a lot of teens in my clinic who are due for vaccines. And when I am seeing a teenager by himself without a parent, usually they're 15 or above, most of them don't want to receive any additional vaccines in that moment. They're usually coming to see me for reproductive health or a behavioral health concern. And but I always wedge it in there. I always say, these are the vaccines you're eligible for. Can we please just talk about it next week? I tried to bring them back if they don't want to get that vaccine. So it's a lot of education with teens about, you know, facts. This is something to keep you healthy. It's safe. A lot of other teenagers that come in to see me either have this vaccine or I recommend it to them. So when I'm talking to teens specifically about vaccines, I really enjoy those conversations because I feel that there's not a lot of bias there with most teenagers. So if I can speak to them openly about it and give them information, a lot of them are eager and happy to get those vaccines.
Yeah, I think it's a really interesting area of medicine when you start working with adolescents, because you know, that's when, you know, especially here, you know, after 14, they can just choose to vaccinate without parental consent. I don't know that I've had any kiddos do that. I mean, I had one kiddo do that actually, but it's not common. But it's an interesting dynamic because, I mean, first off, I think personally it's very important that we respect children as people. Like, they have autonomy. From birth, they have autonomy. And I don't think that the idea of parental rights is like I think it's nonsense. Parents don't have rights for their children. They have responsibilities to their children, the responsibility to provide care for their kids. And so I always try to include kids in the conversation to the extent that's possible. As children get older, that becomes more direct with vaccines, and I'll start talking directly to them about like, what are your thoughts and questions about these vaccines? And oftentimes it's nice if I can have a conversation with the child alone, and we'll talk about like, what are your plans for your vaccines? Like, this is what you're due for, and I have patients who they've not gotten however many vaccines because that's what their parents say, and I try as early and often as I can to undermine that and say, look, this is not your parents' choice. It's your choice. Now, I'm not telling you should not listen to your parent. I like to listen to my parents too, even as an adult. I think that is valid. And also, you have responsibility to take this decision as well. And you can choose to do what your parent wants, and you can choose to do something differently. And you can choose to take an active role in making that decision with your parent and have the conversation with them. So if they tell you like they don't want you to get this, it is your right. And I would say responsibility, say, well, tell me why, like, let's talk about this because this is my choice. This is my body. And I want to know, the reason behind that. And I'll have that conversation very openly. So I had a patient just a couple of weeks ago, and they were 13. And the parent was saying they didn't want to take, I think, the COVID or HPV or flu vaccine, those are three of the more common ones people will opt out of in my practice. And so each time I would, I brought up each one specifically, and it's okay, so they're due for this, and what are your thoughts on that? Say, no, we don't want to do that at all. And like, there wasn't much room to have the conversation. But then I would turn to the patient, the 13-year-old girl, and say, and what about you? Do you have any questions or thoughts about that? And at one point, by the third time I did this, the mom was like, I think these questions should be directed to me because like I'm the one making these decisions. And I said, I'm glad you brought that up. This is a good point. You are legally responsible for this decision, and whatever you say goes. That's true. However, I'm not your doctor. I'm your daughter's doctor, and she has the right to have input and say over these decisions. Whether or not she legally is capable of making this choice, she still gets to ask whatever question she has for me and have the conversation, and has the right to the knowledge about the vaccine that I can share if she wants it. And next year, she will be the one making this decision, regardless of what you want her to do. And I think just because she turns a year older doesn't mean all of a sudden the decision-making should go from you alone to her alone. I think it should be a collaborative process. And I think it helps to start that collaboration earlier than later. So that's the way I try to frame it. And just always try to encourage kiddos to think about themselves as like the autonomous decision makers for their bodies and their health, so that I do tell them explicitly, I don't necessarily want you to not do what your parent told you to do. Like, I think you should, talk with your parents. They are an important part of your life. And I don't want you just like going behind their backs, making decisions they don't agree with. But I also think, this is an important decision you should take a role in making. I don't know if you have anything to add.
That was very well said, and reflects how I tend to approach it in practice as well. I don't have anything meaningful to add to that. Well done.
I have a quick follow-up question to that. How do you culturally tailor those conversations for people of different ethnicity and backgrounds?
I've had that specific conversation one time. So, I'm learning new things every day. And it's only recently that I've started to be able to feel comfortable being as brutally honest as I just was, and like really call things out as I think they should be. But I would say I try to read the room. I try to get a sense for, I think the culture is kind of secondary. It's really about the relationship. And there, depending on people's backgrounds, they may have different perceptions of like the power dynamic between me and themselves and from the parent and the child. But I think at the end of the day, what I try to do in the room is promote a relationship that I think is the most important, which is one of collaboration and mutual respect and autonomy between myself and everyone else in the room. I try to dismantle the power structure, both between parent and child and between myself and patient, because I don't think it's helpful. And maybe not everyone feels that way, and certainly that will vary across cultures as well. There's certain people who will be very much thinking like, no, you're the doctor, you're in charge. I'm the parent, I'm in charge, and that's fine. And I might not be able to dismantle that, but I think it's toxic. I think it's damaging, and there's an extent to which in every culture I know of and am familiar with, there is this idea that like, the doctor needs to be the boss, and then the parent needs to be the boss of the child. And I don't think it's helpful. I think we need to treat each other as adults and respectfully and autonomous decision makers in charge of our own bodies. And so that's what I try to address. And I do try to actively undermine ideas to the contrary, regardless of where they come from. I don't know if that's the right way to go about it, but it's what works for me. It's what I feel is the most authentic way to approach the conversation. I think these barriers we put up between people, whether it's parent or child or doctor and provider, I think it undermines our goal of building human connections and understanding where we're coming from and helping each other make the best decisions for our health.
Okay. Yeah. And what's interesting is developmentally with a teenager specifically, there's lots of different things going on in the brain. And so I like to really tap into, this is a decision that you get to make for your body, and kind of make it exciting when we're talking about vaccinations. But culturally, absolutely, there's a lot of kids that look at their parent more than other cultures for everything, and they're the decision maker. In well child visits with preteens, teens, there's a confidential part of the exam, and I always make sure that the parent's okay that we do this, and these are the topics we're going to discuss. And so in that part of the visit, if I know that there's been expression between the parent and the child that they don't want them to get this vaccine, I'll just say again in that moment, I just want to say in this moment that your decision to vaccinate your body is your decision, and it doesn't make you a bad kid. It doesn't mean you're going against your parents. It doesn't mean you're going against cultural wishes. I mean, maybe it does in certain situations, but it doesn't make you a bad kid. And you are the advocate for your body. So, but those can be very, very hard situations culturally.
One aspect of culture that I think has become more on the forefront, especially over the last few years, has been where people are getting their information from and what silos they are in or are not in with regards to who they're talking to about these decisions and how they're framing and conceptualizing them. And a big shift that I've noticed when I have these conversations, I suspect you guys have as well, is that I have to, in real time, try and figure out what information silo they're in and what are the limits of the discourse that we're going to have in office today, because you're going to run up against that. And once you start getting against those barriers, you get a lot of immediate oppositional attitudes and digging in. So it becomes very subtle and very difficult to find the edges of the discussion. And it used to be a little more well-defined. Again, it's kind of pre-pandemic before we lost some of that trust.
I know there's another question in the room. I'll be giving you in just a second, but I want to remind everyone who's online that in the Whova app, they can list their questions, and we have someone here to read them. So just because you're participating virtually doesn't mean you can't be part of the conversation. So just a little pitch to everyone virtually attending.
Good morning, Dr. Jim Gardino. I wanted to start with a large frame of where we're at with public health first. A recent study showed that looking at federal funding for health, only maybe 4% was directed at public health and our prevention system. Oregon has, in good times, 11 years ago, was ranked 47th in the nation for per capita funding by our legislature to our public health system. We have public health modernization, but it's been just a slow amount of money to actually get health departments up to where they actually could be and should be. And now, just this past year, the legislature flat funded public health rather than realizing that public health people have worked really hard for COVID and now are turning to all the 7 other public health threats here. I wanted to mention that I have a check history of being the first person to study of vaccine hesitancy among parents of school-age children in the statewide survey we did in 2006. And we found a couple of interesting things that I've been hearing you say this, so it resonates. But we had a scale of vaccine beliefs. And, but we sampled based on the percent of exemptions in the community. So we had high exemptions from vaccine requirements and low and medium. So most parents actually fell in that middle ground where they are like open, they're looking for information but if you were in a high exemption area, you're more likely to accept, even if you didn't personally believe necessarily. And if you were in a low exemption area and you vaccinated, that was an interesting group. With just 2 small numbers, but that was a very interesting group of people that were like, I'm not going to be convinced by any other people. So the question I wanted to turn back to you is that, so given our funding level for public health is again taking a dive, and given we have new challenges coming up, we have vaccines now for COVID that are now going to be they're going to be charged for, and we have a new RSV vaccine, and we have flu season hitting. Share a little bit about where you're coming from or what you think providers and people that care for children and families need to be thinking about. What are the challenges that you're going to be facing with this new change? Thank you so much for your work.
So anytime there's something new or different in immunization policy, there's always a ton of questions around it and also a ton of new misinformation that is being generated in real time and is very hard to keep up with. And especially with these new immunizations, I get questions about things that I have not heard before because it's a piece of misinformation that was posted on Twitter or X or whatever we're calling it now 2 days ago. And it has no foundation in reality. So there's nothing that you can say. You can't fact check a myth, right? In the same way that you can fact check a piece of information. And so that gets really challenging because then what you're dealing with is trust and building that therapeutic rapport. And when you push too hard, you start to really fray that at the edges. And so oftentimes the way I will approach those conversations of, hey, we have some new things coming down the pipe. There are going to be some changes in the recommendations. We're not exactly sure, until the last couple of days, who was going to be recommended to get the new booster and at what age and all of that. But I want you to know that when that happens, when we have those recommendations, I want you to ask me if you have questions about something specific. And that, my goal isn't that you do one certain thing. My goal is that you make a decision that feels right for you and your family. And I want to give you the information to make that decision. And rather than chasing your tail on these very, very specific minutia of lies on the internet, you can just be there with them in real time and hold that space to have that conversation. And that's been relatively effective at kind of short-circuiting the conversation around, well, I saw this image macro that made me afraid of RSV vaccines now.
Yeah. Access to getting vaccines is tricky, and Max and I work in community health at a federally qualified health center. We're considered a safety net clinic, so we see a lot of patients on Medicaid, under or uninsured, Medicare, and some private insurance. And what I take very seriously and I'm very passionate about in that work is that we know that minority populations, low socioeconomic and low literacy, health literacy, just in general, folks in those populations tend to be less immunized. And then coupled with, vaccine costs, especially for the COVID vaccine, now becoming something that people have to pay for, my patient population isn't just going to pay for that vaccine. So having the opportunity at a school-based health center and the VFC vaccine program in the state for youth is fabulous, because we don't have a county health department in Washington County that vaccinates children anymore. So as a school-based health centers especially, we are kind of like the really big safety net there for a lot of families, especially for new immigrant families. And I kind of got lost in my little spiel there. But so I know that we're providing good access through our community health centers at the school-based health centers. Something that I'm very passionate about is working with the district nurses to do vaccine events at different schools within the school district. We are the second largest school district in the state, and we have 2 school-based health centers for almost 40,000 children.
That's probably enough.
Portland Public Schools has 9 for 46,000 kids. So anyway, we work very hard, but there's not enough of us to provide care there. So my answer to that is just to be really a big advocate for vaccines and getting vaccine events out to just different schools within the district, just because we're so limited just being in one place.
I get lost in my spiels all the time. So I sympathize.
Where was I going?
I think yes to everything y'all both said. Also, I think it's important for everyone who cares about vaccines and public health and kids, or just people in general, to engage in the civic process. We need to build community, and we need to rebuild our government. We have, as you said, very poor funding for public health. We have very misaligned priorities in the systems we have created to structure the way we deliver healthcare and food and housing and education. Everything is profit first. This is part of why some of the problems you mentioned are problems. The COVID vaccine is going to be a problem for a lot of clinics, because Pfizer and Moderna are charging more for it because they need to make a profit. And that's not because they're good or bad, it's because they're corporations. They're profit driven. The people there are, good people who have done good work, mostly, I assume. The vaccinologists in particular, their goal was to create a vaccine that saved lives, and they accomplished it, and they've saved millions of lives. And also, if they don't get a salary, they don't pay their bills. And so that is a fundamental problem. Same thing with the RSV immunization or Sevimab coming out that could be $400 a dose. These are charges that clinics are going to have to pay to be able to administer. And I think my colleague Kelly McDonald will be speaking more on this in the next session. But the VFC has some barriers to participation, one of which is requiring a double stock of vaccines. You have to purchase an entire private supply of vaccines. And I never fully understood this until recently with working with OIP. But my clinic, I will have patients come in and say, I'll tell my MA, hey, we need to give them the flu shot. And they'll say, oh, no, we can't give it to them. We only have VFC vaccines. Like, what does that mean? It's the same shot. But it's not, because you have this requirement of double supplies because of this concern for fraud. And this is, I think, another tenet of the core problem is that, why is there a fraud prevention measure in a vaccine program, for a vaccine for children's program? The idea is somehow we're going to have massive amounts of fraudulently supplied vaccines to kids, and we need to take measures to prevent that, even though those measures are now making it so that there are clinics in Oregon who can't participate in VFC. It's absurd. And we're losing money on it. We're concerned about the money, but we lose money when we don't vaccinate kids and when we don't prioritize public health. We're trying to cut our budget by not funding public health. Well, look where that got us with COVID. We had a whole pandemic response team that the administration abolished before the pandemic, and who knows how much that might have helped us in curbing the cost, the billions of dollars that we spent in this pandemic. So I think we need to have a fundamental understanding at a societal level that every individual person needs to know. If we are not spending money to keep people healthy and support people's wellness and just ensure that everyone has access to things that everyone should have access to, regardless of their ability to pay, then we're going to be losing money. And more importantly, we're going to be losing lives. And so I think my answer is, in addition to all those things that we can do as an individual level within the clinic and having respectful conversations with patients, acknowledging that, there's a 50% vaccination rate for flu each year. None of us are going to get that up, past 60 even. Even if we do perfect relationship building, motivational interviewing in every single patient encounter. To do that, we need better policies and better funding and better structures. We need our legislators to respond to the will of the people and the good of the people rather than the profit-driving lobbyists that work for them. And I think that's my biggest message, is get out and actually try and do some work in a legislative sense.
I noticed earlier a lot of hands went up on the question of parents. Can we do that again really briefly? Who here has kids? All right. Do you feel 100% supported by society at large in being able to take care of your kids? Right? We have systemically divested from the care of children, and this is not an Oregon problem, although Oregon has this problem. And the thing about those kids is they become adults. And they have chronic needs that are a result of what happens when you are a kid if you don't have access to the resources that you need. And the short-term thinking of, well, we can't fund this, we can't get resources for that, snowballs into just incredible problems later on. And to what you were saying, Ryan, we need better resources available in early life.
Everyone online is so quiet, so let me get it in. I think I'll go to one of our questions here.
I think there was one.
Oh, is there another question in the room? Sorry.
If that's okay. Good morning. So this question being more of a strategy education question. How can hepatitis B space, and some of the feedback that we get is, like, in the spirit of immunization neighborhood, healthcare providers may not be as, I guess it's not, there's not a cohesive message. Let's say a pharmacist will recommend the vaccine, and then the patient says, well, I'm going to double check with my provider, and the provider says, you may not need this. There may not be communication on updated guidelines or updated strategies on vaccination. What are you guys' thoughts on educating maybe providers so that at least we can have the same message of a nurse, an MA, a pharmacy tech, a pharmacist? If we all say the same message and echo each other, that might help boost immunization rates in general, not specific to any vaccine, but just in general.
Yep. Yeah, Siri's gonna answer for us. Yeah.
Let's hear what Siri.
Yeah, I know. Yeah, let's get Chat GPT in. Yeah. That's perfect.
So specific to hepatitis B, I do see a lot of questions about it because folks who maybe didn't get it when they were younger, or for whom the immunization record isn't updated, it will flash in the EMR, something that you could talk to them about all the time. And normally I'll broach it from almost a comedic standpoint, like, my computer tries really hard, but it's not that smart. It's saying that you may have had your hepatitis B vaccine. And do you know if that's been administered? And some people do know, some people don't know. And I'll say, well, hey, have you lived in Oregon your whole life? And then you kind of get into the conversation of, well, it's possible you've had this, but it doesn't look like you have. And if we don't have records for it, it's safe and indicated for you to be immunized against this, both for yourself and for the people who are around you. And that one tends to be lower drama. I don't hear as much crazy misinformation around hepatitis B, other than the infant shot.
Other than what is hepatitis?
Yeah, or what? Yeah. So I usually just kind of approach it from hey, it looks like this hasn't been done. This is really a good idea. Can we talk about it more? We're pretty receptive to that particular inquiry.
Yeah. Our clinic does a pretty good job about disseminating information, updated information regarding surrounding vaccines through our clinic nurses. They're in charge of ordering vaccines for our clinics. They do a lot of education amongst themselves, and then that gets distributed out to our all provider meetings and to our staff meetings there. So as far as how we do better to assure that people are getting similar messages, I think it's really the responsibility as providers to make sure that we're up to date with what's being recommended and what guidelines are, and that we encourage our fellow team members in clinic settings to all be on the same page there.
I had a lot of experiences in the early stages of the pandemic where this was a very serious problem, where in particular a lot of ER providers or patients who went to the ER would come back with the sense that they couldn't get the COVID vaccine for 90 days after getting sick, which is not true. It's never been true. A lot of people still think this. You just can't get it till while you're sick, and then you can get it afterwards. But you don't necessarily need it for 90 days, and this message became confusing. And that was a simple misunderstanding that led to a lot of people to not get a vaccine when they could have. And there were many instances of this. And this is a particular challenge because it was a time when, there was just so much rapid information change, it was hard for people to keep up. But I think it illustrated the underlying problem that within healthcare in this country in particular, probably others, we don't do well at ensuring that providers are up to date on the best medical recommendations. If you see a very old medical provider, they could be fantastic. They could have years of experience and they might know everything. Also, they might be horrible. They might have been doing something like for 50 years that's been out of date for 30 and not know. And again, there's some who are great and some who are not. But the same is true of young providers. But the idea is that we don't have any way to guarantee the quality of care you get from a given provider. There are providers who I know and who I am aware of who recommend against some or all vaccines. And, they went to medical school just like me. But I think the message that we need to take from that is our education system is inadequate for both general education as well as medical education in particular. And two, that we need to have more than just a system where you go to school and then you start working and then you just focus on making your paycheck. We do need an integrated structure of making sure we have a way for people to continue to learn and have the best up-to-date information. And that needs to be transparent, and there needs to be ways for us to educate the public as well. And I think that starts with a robust public health system, because how is an ER provider or me as a clinician or any other provider supposed to know what the latest recommendations are if they don't go actively looking for it? Because there's not a good way for us to get accurate information reliably. We don't have a good structure set up within our society for that. No one's listening to C-SPAN and listening to daily press conferences. And the people who do, I pity, because that is a horrendous experience. So I think that needs to change. I think our medical education has some specific changes we should make. We should start to undermine this power differential between providers and patients, so that patients are starting to learn that they don't need to listen to us. They don't care about expertise, and they understand maybe you don't actually know what's best. And a lot of times they're wrong, and a lot of times they're right. And I think we need to acknowledge that too, is that, just because I went to medical school doesn't mean I suddenly know everything and all the best decisions for all of my patients. I frequently don't. My patients often know what's best for them. And I think we need to start with that approach in medical school and teaching some humility to our providers. And I think we need to teach basic vaccine science in public education. I think a lot of kids these days who grew up in the last few years know a lot more about vaccines than I ever did, but that needs to be standard curriculum. We need to teach people how basic science about our health works so they can make informed decisions. I shouldn't be creating health literacy and giving whole educational courses in my 20-minute clinic to a patient to help them understand their medical problem. But that's what I have to do because there is no public awareness of basic disease pathology and how an immune system works. Or at least what is there is not reliable, which is why disinformation is so effective. I think I've rambled enough.
Thanks. This is for Dr. Cohen. I was surprised to learn that you were a naturopath, that you're here. In my experience, some of our strongest vaccine opponents are naturopaths. And so I was wondering if you could speak to that a little bit, and thank you for being an outspoken vaccine supporter in your field.
So I think it's a multifaceted problem with no clear-cut solutions. There are absolutely vocal NDs or lay naturopaths who are anti-vaccine, and they make a lot of noise, and they get a lot of attention because they make a lot of noise. And part of that is that there's a practice model that exists within the profession where you need attention in order to drive patients to your clinic. And that's oftentimes how people get that attention. This is not exclusive to NDs. And there was a research study recently published on the 10 biggest vaccine misinformation providers on the internet during the pandemic. 0 of them were NDs. They were all DOs. And so I think that we get a lot of excess attention because we're perceived as outsiders, despite the fact that many of us do work in a very conventional setting. I think of how I want to describe it. I think it's a double-edged sword in that when patients come to me expecting me to be anti-vaccine, they are very surprised. And usually that moment of stunned awe, of like, wait, you're not doing what I expected, gives me a window of opportunity to explain why. And I'll lean into the fact that I can't think of a more natural intervention than an immunization. We take a naturally occurring protein or polysaccharide, or we expose it to your naturally occurring immune system, and your immune system does what it was going to do regardless of how it was exposed to this protein, and it makes an immune response. What is unnatural about this, other than you didn't have to get sick? And the idea that I'm going to get sick in order to not get sick, which is what the natural immunity community is all about. That's a weird flex. I got sick so I don't have to get sick. I'm like, okay, but you got a lot of risk from that, and you don't need to expose yourself to all that. And so I think that unfortunately there are vocal people in my medical community who are anti-vaccine. I think that they receive an untoward amount of attention because they are bad actors. But in general, a lot of us are just kind of out there in the trenches doing very conventional style immunization counseling, and either don't have the time or energy to speak up. I know we have clinicians in the room, and you don't have a lot of time and space after the end of your day to do a lot of advocacy. Whereas if I have a cash pay practice and I need to get people in the door and I want to go on Twitter and talk about ice baths and good vibes, you can get people in the door that way, right? You can get a lot of attention. So I think there's a lot of competing incentives in there.
I think we need to wrap it up, actually, and I have the final question. I hope there's more time to keep this great discussion going, but it ties into, you may already feel, Dr. Cohen, if you answered this, but what about your field gives you the space, a unique opportunity to address vaccine confidence? Or the reverse could also be true. How do you find you're stuck with a unique challenge in your work? So I want to give everyone a chance to answer that. I feel like you already did, but if you have extra thoughts, do about it.
You've all been kind enough to listen to me so far, so I'm going to pass on.
Okay, thank you. As a family nurse practitioner, something that is pretty neat for me is that I had the opportunity to be a bedside nurse for 16 years before going into practice as a medical provider. So I had a lot of experience working with families, working with pediatric patients primarily in my bedside nurse experience and in the pediatric ER. And so I had a lot of opportunity to witness what happens in medical hierarchy, meaning what families would say to me, feel comfortable to say to me, and what I would witness maybe they wouldn't feel comfortable to say to their medical provider, or I would witness poor bedside care manner conversations to these patients and families. Nursing is a pretty trusted profession within healthcare. So I took that to heart when I decided to become a family nurse practitioner, and I knew that I had a great opportunity to gain trust in my patients and in my and in their family members. So how that relates to, you know, the conversation around vaccines is that I have a strong passion for preventative health. And so I can make every, you know, interaction with a patient, if I have time, which I try, about vaccines and what they're eligible for. I can talk about morbidity associated with not getting vaccines and how that can affect their daily life. I am a single mom, so I can relate to my patients on a lot of levels. I can talk about how difficult it is to be a parent, how difficult it is to be a working person in this country, and then tie that into why health is so important and what we can do to actually keep you out of clinics like this. That's very relatable to a lot of people. So I feel fortunate, and I feel like I have a great opportunity in my practice, therefore, to really promote vaccines and how that can improve quality of life for people.
I have the privilege, I suppose, of being at the top of that medical hierarchy. I'm the MD, so like, you know, traditionally it's like MD at the top, then maybe some middle levels, maybe the naturopath, nurse at the bottom around the toilets. You know, like this is how the structure is. And if you spend time in healthcare, especially if you spend time in a hospital or if you go to a residency, some worse than others, you will see this is played out. And so there's two advantages that affords me. One is like a lot of people are going to be more inclined to listen to me because they have this perception. But the other is that I have the opportunity to break that down in every interaction I have and say, hey, you know what? This total poll is nonsense. Like, don't put me on the top here. I'm at the same level as you. And there are plenty of providers at all levels, like my colleagues here, who are just as competent or more competent than I am. And there's plenty of patients who have taught me so much about what it means to be a good parent as a new parent, and what is, you know, important to them as individuals. And so I think it's one of the best places to do what I think is some of the most important work of medicine, which is to reshape the nature of our relationships with each other, and try to build a community of mutual respect where people are thought of as humans first and neighbors first, rather than like, you're the doctor, you're the naturopath, you're the parent, and you're the kid. And so that, I think, is one of the things I appreciate most about the perspective that I have.
Any closing thoughts you'd like to share? Everyone can join me in thanking our panel. We really appreciate it.
Thank you so much.
Thank you.
We have about a 10-minute break now. Please go get some food. There's food, there's coffee, make phone calls, check your emails. We'll come back together at about 10:40. The day's already getting away from me. For our next panel, broader views, statewide data, and challenges in access.
Thank you.
Thank you. Hi, everyone. I'm Kelly McDonald. I'm with OHA, the immunization program. Really happy to be here. I am the Access Modernization Manager for the Oregon Immunization Program, which essentially means looking for policy and systems level solutions to gaps in immunization access statewide. I want to just point out the obvious that I am one person, and according to the slide, there should be three of us. So both Rex and Stacy are not able to be here today. They're both sick. So when I heard one and then two, I thought I was being punked, but apparently not. So that's okay. So I have their slides, and what I'm going to do is just go through sort of each section. I'll talk first about some data trends, particularly around 2-year-old immunization rates, adolescent rates. Then I'll move into Stacy's work. She's our school law coordinator. Her work around our immunization requirements for school and child care attendants. And then I'll wrap it up with some discussion about gaps in access. Dr. Hassan alluded to some of that a little bit earlier, so I'll provide some more information. Okay. So I'm Rex, immunization rates and data trends. Okay, so this is a really busy slide. I know there's a lot going on. Don't feel like you need to, be able to read it all or take it all in. So what you're looking at, this is from the most recent rates, 2022 rates. That's on the far right-hand side there. Far right-hand side. And it includes the cohort of babies born during the first year of the pandemic. So those babies, of course, during that time, there were significant disruptions in care. And what you really want to see when you look at this slide is the trend line over on the right. So that's for the last 5 years, from 2018 through 2022. And you can see just at a visual glance at the trend lines that they're not going in the right direction. So we've had a 2% decline, which may not seem like a lot, but in context, it's important to just recognize that we did have a steady increase for the last decade. So to now have that drop down, even though it's expected, it's a bit alarming. And then the other thing I wanted to let you know is that this data, and really a lot of our data, it's available on our website. I'll talk about that in a little bit. But we also are planning to move to quarterly publishing of these rates so that we have more, sort of real time what's happening. Okay. This is the same that I'm going to actually go back for 1 second and just point out that this is looking at the up-to-date rate for those vaccines that we affectionately refer to as 4313314. Just rolls right off the tongue. So that's, 4 doses of DTaP, 3 doses of IPV, 1 of MMR, 3 doses of Hib, 3 doses of Hep B, 1 dose of varicella, and 4 doses of PCV. So just going ahead again, this is that same look, but broken down by county.
The numbers, the 4, 3, whatever.
Yes.
Are those the legally required ones that kids need for school, or the recommendations from CDC, or what are those?
Those are according to the ACIP recommended vaccines. Yeah.
They're not the legal required.
Correct. Yeah, there's some differences there in terms of what's required for school entry and based on age. Yeah, we'll get into that in a bit. And I'll just say too that I'll go through all 3. Questions are fine, but we'll take most of them at the end just so that I can get through the 3 sets. But please jot down your thoughts so that we can get to them. If I can't answer them, I do have some colleagues here from the immunization program, and I'll do my best to represent Rex and Stacy as well. Okay, so this is looking at the county rates. And so what's helpful to know about this, a couple things. You can see some urban-rural disparities. Also, if you're on our website looking at this data, you can click onto a county, and that will provide more deeper dive into what's there per county. I'll show you an example of that in just a second. For some counties that are especially rural or frontier, you can see like for Gillum and Wheeler counties, there's this little number sign there. That's just cautioning that when numbers are really small, it can have quite a big impact on the rates. And so that's typically like between 10 and 49 people. The estimates can really vary year to year. Okay. So if you were to click on a county, you could bring up, again, this is county specific. So that same first slide I showed you, but county specific. It's really helpful to see, depending on where you live and work, what's happening locally. So that data is available as well. At the county level, you can also sort of break it down by like your WIC clients versus non-WIC, those that are enrolled in the Oregon Health Plan, of course, by race and ethnicity. And again, anywhere that you see the sort of asterisk, that's representative of few numbers. And so the data is not displayed when the numbers are small enough, less than 50 people. Okay, so similar type of data, but this is specific to adolescents and looking at the last 5 years. So again, note the trend line, either mostly going down, some sort of staying steady. Looking at the bottom here, the teen series, fairly low for completion of the teen series. There are 3 vaccines recommended around 11, 12 years old: Tdap, HPV, and meningococcal vaccine. I want to draw your attention to up here at the top. This is the Tdap 1 dose. You can see how that particular vaccine is so much higher than the rest. I just want to point out that that is a vaccine that's recommended for 7th grade attendance. So you can really see the impact of that recommendation, that requirement for school attendance and how it impacts the rates. These were increasing incrementally, and again, now a slight dip. And then similarly to the 2-year-old up-to-date rates, this is HPV specific, but broken down by county. Again, you can click through to see more specific information. This is just an example from Lincoln County, so you can really look at locally how that plays out. I don't have flu slides today. Again, that would show a decline the past couple of years following a peak that we had during the pandemic when sort of that first year when folks were really concerned about that, potential twindemic of COVID and flu in that first year. Things sort of peaked up a little and then have dropped off quite a bit. We track flu activity, and we have a weekly report on our website called Flu Bites. And so that usually starts, I think, around mid-October, and then is published weekly so you can track sort of what the activity level is around the country and Oregon specifically. So how to get this data? The easiest way is to Google the OHA immunization program. Click on the first link that comes up. And this is our homepage. So I think it's helpful to know, we put this data out, but for folks to actually access the data, know where to go to find it and to be up to date on statewide and local information. So you can see right here where we have data and reports, that's where you would find all the information I just showed you. We have a section for school and child care, provider specific information around our model protocols, pharmacy, different training, our Alert IAS registry, and others. If you were to click on the data and reports button, this is where you would find all of that information here. So we've got child, adolescent, adult immunization rates and seasonal flu. Our data staff are working really hard to get back to updating this regularly after, just trying to get back to some of that routine work that took a hit during the pandemic. Okay. So now I'm Stacy. Stacy is our school law coordinator, immunization school law coordinator. And I want to share with you the data in particular from last school year and some of the trends that we've been seeing over the last couple of decades. So the basics of the Oregon school immunization requirements. First, I just want to recognize that this represents a tremendous amount of work, a lot of work for schools, childcare centers, local health departments, of course, clinics, and staff at the immunization program as well. And so why do we do this every year? We do it because it protects over 650,000 children from vaccine preventable diseases. And of course, when we protect those kids, we're protecting people around the kids. So it really helps build that community immunity. And it's just one time each year that kids are brought up to date on vaccines, that their records are looked at, and it's a way to just maintain a healthy populace. Okay. Okay, so where are immunizations required in Oregon? Children facilities, so that includes certified childcare. It includes Head Start and preschools. All of our schools, K through 12, public and private. And then in colleges, there is a requirement for 2 doses of measles vaccine, and then there are some other requirements on the colleges. You hear about exemptions. There are 2 types of exemptions. There are medical and non-medical exemptions, and I'll get into that in a bit. Okay, so this is the annual timeline. It's the same every year. Back to school, records must show at least 1 dose of vaccine to be able to enter school, or an exemption. And then in the fall, the schools work really closely with families to try to get those records updated. Exclusion Day happens the 3rd Wednesday in February every year. All records must be updated with either the immunizations that are due or an exemption by that time. If they're not, then the child is excluded until they have that documentation, and they can go straight back. That deadline happens in February, well into the school year, to give plenty of time to schools who are working with parents, to parents and guardians, to get those vaccinations. And then in the spring, we collect all the data from schools, verify it, and publish reports. So looking at some of the rates, this is looking at the percent of kids complete for each vaccine. So the yellow is the childcare rates. That's childcare, preschool, and Head Start. And then the green is the K-12. And so, you know, it's pretty high, upwards around 95% when you look at all of them. And it's really significant, though, to recognize that there's a lot of school-to-school variability in the rates, which we'll talk about, and what the potential impact of that can be. Okay, so this is looking at kindergartners for the last 4 years, vaccines that are given at kindergarten entry. There are 3 required vaccines: DTaP, polio, and the 2nd dose of measles. So the blue bar is 2020. That data is collected in March, or looked at in March. So this is March 2020, right before the pandemic. So it really serves as a baseline. And then, of course, we've got 21, 22, and 23 up there. So you can see there was a decrease, slight decrease, and a blip up again, and then now a further decrease this past year across the board. This is a new visualization that I am very excited about. It's super helpful for everybody. It includes current and historical data, so you can change it by year. You can change it by county. You can look at statewide rates. Or like I said, you can drill down into county level as well. Up at the top, you can see that we've got, this is the page for kindergarten immunizations. You also have K-12 data, exemption data for kindergartners, and then exclusions. And this can all be found, again, going back to our homepage, there's that childcare section, and you can access all of this there. Okay, so looking at exemptions, I know there was a comment earlier about the increase in exemptions, or perceived increase. So I'll talk about that a little bit. First, though, I want to just show you the stark difference between medical exemptions and non-medical exemption. It really is non-medical exemptions that make up the vast majority. So the yellow here is our childcare facilities, green is K-12, childcare facilities around a little over 5%, and the K through 12 upwards of 6.5%. This is an interesting historical look at kindergarten non-medical exemption rates. So you can see that it really, for the first several years, this is going back to 1986, you can see it really was just sort of steady around 1% for years. And then there it started to increase pretty steeply and significantly. This blip here down to 5.3 is really just a reflection of the pandemic and reporting disruptions that happened that year. So kind of take that with a grain of salt, but going up to this past school year up at 8.1% as an all-time high. Now this I find super interesting to see the comparison. And Stacy, our immunization school law coordinator, has been tracking for many, many years and mapping for many years what our exemption data looks like. So this is kindergarten and first grade non-medical exemptions back in the 2000-2001 school year. So just take a look. The brighter the blue, the higher the exemption rate. I would caution you about Wallowa to sort of, again, super rural population, small numbers, just a few kids can really impact the rate. So again, with a grain of salt there, that fluctuates pretty significantly year to year in those populations. So there's a lot of white. And then instead of going through every year, which is fun, but in the interest of time, I'm just gonna skip to last year. And it looks like this. So yes, it's gone up quite a bit. And it's pretty striking. And in the past year, so spring of 2023 compared to spring of 2022, we had an increase in non-medical exemptions in all but 6 counties. Yeah. Yeah, striking. And again, this is all available on our website. Okay, so talking about school level data. This is an interactive map. Shows all schools and childcare programs in Oregon. I find this just incredibly helpful information. So if you're a parent, it could be super interesting, right? To see, what the breakdown looks like at the schools in your community or where your children go. If you are a local public health department employee, it might be really helpful in how you're planning outreach or working with clinics or talking with schools. If you're a clinician, of course, it might be really interesting to look at, your patient population and if they attend a certain group of schools in your area to look at those. And what I love about it is that you can zoom in and you can click on all of these dots. So if you click on one, you get this interactive pop-up, and it'll tell you, the number of kids in that school that were included in the last report. It will tell you the percent vaccinated, break it down by vaccine. It'll tell you medical versus non-medical exemptions. Just a lot of really interesting and helpful data. And state and county data is really helpful, but when we think about the risk of an outbreak, school level data is critical. So this is school level for just one vaccine, which is measles vaccine. And this blue blob is actually representative of about 1,700 schools in Oregon with at least 10 students. And it's showing the percentage with 2 doses of measles containing vaccine. And so the median is 96%. So that means that, half of these schools, half of these 1,700 schools and childcares are below 96 and half are above 96. And if you add in using 93% as the herd immunity threshold, and of course the threshold is different for different diseases depending on how contagious they are, and it's really high for measles because it's quite contagious. So if you have it at 93%, then you really want your school to extend above the yellow line. And this looks at first glance like great news. Look at that, most schools are below the yellow line. However, yes, 74% of schools reach herd immunity, But that leaves a whole quarter of schools that don't, which is significant. And that quarter of schools is 442 schools that are below the yellow line for last spring. And, that's just low enough that if a case were to occur, we'd be concerned that it could spread, there could be an outbreak. So again, that school level data is really critical. Okay, switching gears, now I'm me. I want to talk a bit about gaps in access to vaccines. There has been a growing trend in this. Some of that is anecdotal. It's hard to track in terms of data, but we are trying to get our hands around it as best we can. We have known for a long time, there have always been some clinics that don't vaccinate, right? Some small volume clinics, maybe they don't vaccinate or they don't participate in the Vaccines for Children program because they have very few kids that they see. There have also been for some time concierge type providers that don't vaccinate their patients. Then what started to happen several years back is hearing about a large clinic organization in the metro area that was consolidating their vaccines to one clinic. So they had multiple clinics throughout the area, the metro area, and they decided to have all of their vaccines only administered at one of those sites. So if you're a parent and you have a child at one of the other sites, you are of course making your well child visits and you're going in, and then you're also scheduling an appointment and having to go to the other location for your vaccines. Obviously, huge opportunity to miss out on getting vaccinated and a real concern. Then recently, we've heard of more large clinic organizations making that same decision. So opting to consolidate vaccines at one location. So why? Dr. Hassan, talked about the VFC program and some of the policies that can actually be a barrier. That's true. Just to be clear, the Vaccines for Children program, that is to provide vaccines at no charge for kids who are up from birth up through their 18th year, so before they turn 19, who are uninsured on the Oregon Health Plan or American Indian Alaska Native. And the VFC program started over 30 years ago to address gaps in access for that group of kids. There was a big measles outbreak, and it was the federal government's response to making sure that there was equity and that every kid had access to vaccines. However, since that time, it's just become harder to manage due to the growing complexity. So that is the number of vaccines, the cost, the conversations with parents, right? So all the increase in hesitancy, concerns, impact of the pandemic, it's just become harder to manage that. VFC policy, of course, plays a part in terms of that requirement to maintain 2 separate stocks of vaccine. So as Dr. Hassan said, he has a large practice. He has all of his VFC vaccine and then purchases a whole separate stock for his private pay or his privately insured patients. For some really large practices, that's easier to do. For smaller, especially those smaller volume clinics, it's a huge barrier, especially now that we have more vaccines and very expensive vaccines coming onto the market that they are required to carry. So what happens? Oftentimes, these clinics will then refer to the county. So they'll tell parents, so I'm sorry, we don't vaccinate here, go to the county, go to the health department. And we also know that some health departments are no longer providing clinical immunization services. They may contract with a local FQHC, federally qualified health center, to do that. However, you often have to schedule an appointment, establish care before you can get in. So in some counties, there is a real lack of that, what we think of as that safety net to be able to just go get a vaccine. Again, missed opportunities. These parents become trapped in this loop of non-access where it can become easier to give up, to sign a school exemption versus getting the vaccine. And so we do believe that there is some degree of challenges in access that are playing into that increased rate of school exemptions, that it's not all hesitancy, that sometimes parents just can't get their kids vaccinated and they just want them back in school. So that's a real concern. We also have pharmacies, and pharmacies, if you think of access and ease of access, could be a great option. When it comes to vaccines for children, there are barriers, the same policy barriers, similar policy barriers that exist for clinics, but they also have a different challenge, which is around billing. Pharmacies bill for vaccines and for their services really differently than clinics do. And so that has been a barrier. We've been working to try to overcome that by developing a billing guide for pharmacies so that if they enroll with the program, we can provide some assistance. But during the school exclusion period, if a kid is excluded from school, they can't get a vaccine at their clinic, they can't get a vaccine at the county, they may think I'll just go to a pharmacy. If they're a VFC kid, they can't get a vaccine there either. It's a real challenge. And I'll just add too that at the Oregon Immunization Program, we are challenged just by our infrastructure to be able to manage new enrollment. So should tomorrow all the pharmacies and all the clinics in Oregon who aren't enrolled wanted to, we wouldn't be able to support that. So that we just have sort of systemic challenges all around. The last thing I want to talk about is Oregon's vaccine finance model. And I'll explain how that impacts access. But our finance model is complicated, and it's complicated due to fragmented funding mechanism that's really driven by eligibility, so age and insurance. So I do have a slide to sort of walk through it, and I'll explain how, oh, that's not how that was supposed to work. I had transitions built in and everything, darn it. My best laid plans. Okay, well, try to ignore everything except for what I'm talking about. Okay, so vaccine financing in Oregon. So we have funds from the federal government, okay, and that helps, that pays for our Vaccines for Children vaccine. So again, that's uninsured, American Indian, Alaska Native, Medicaid eligible. We also get some very limited funding called Section 317. And that pays for vaccine for uninsured adults. It does not pay for every vaccine that every uninsured adult would need. And because it's a very limited amount of funds, we have a clinical council that makes decisions about which vaccines are included on that 317 list. It's a growing challenge to make those decisions because we have more vaccines available. For example, there's a new RSV vaccine for adults. There's, of course, COVID vaccine. That'll be an issue in the future. Okay, so that's federal government. And then we have state funding. And so there, about 20 years ago, a little over 20 years ago in the early 2000s, the immunization program developed a program called Billable Vaccine. And the Billable Vaccine program was designed so that providers, it was really just health departments at the time. I'll explain how it's changed. But so those health departments could get all of their vaccine from us, from the immunization program, not have to buy that separate private stock. Because again, that's a lot of upfront funding that sits in inventory in your refrigerator until it's administered. And so, so the Billable Vaccine Project allowed us to purchase all of that vaccine. It would be administered, and then it's coded in our alert registry a specific way with a B code. And then we invoice those clinics for the cost of the vaccine, so they pay it back. So it's really great because we give them plenty of time. They can bill the insurer and then pay us back for it. So for those who are, these are clients who we consider well insured. So they're children and adults with commercial insurance. And they are adults covered by the Oregon Health Plan or Medicare. So they're billable. There's somebody to bill for the cost of that vaccine and service. So they get all of their vaccine from us. It makes it much simpler for them. They administer the vaccine, they bill, they pay us back just for the cost of the vaccine, and they keep the vaccine administration fee. It worked pretty well for quite some time. And we ended up then expanding that into our vaccine access program that was beyond just the local health departments, but instead also included most FQHCs and some private clinics serving special populations. So that would be like naturopaths, community paramedics, school-based health centers, other groups, maybe substance abuse recovery clinics, places like that that maybe serve a small number or they don't have the resources to purchase a whole separate stock of vaccines. So they get it all from us. It's about 300 clinics, almost half. And then the rest of the clinics are VFC, private VFC only clinics. And our vaccine finance model impacts these clinics as well, even though, so just keep in mind, these private VFC only clinics, they have to purchase that separate stock of vaccine and maintain it. But they are being required now to purchase more vaccine and really expensive vaccines, or like the new RSV monoclonal antibody. So our concern, of course, is losing more providers. So as private VFC clinics say, I can't do it. I can't buy 10, 20, 40 doses of the RSV monoclonal antibody or COVID vaccine, that they will disenroll from the program and it'll just further erode access around the state. I don't know what I just did. Oh, okay. I guess I fixed it. So it's a real concern. And then for this billable vaccine group here, we're really faced with concern for this respiratory season that we're entering right now, because again, with COVID commercialization, new RSV vaccines, the RSV monoclonal antibody, not having enough funds to be able to purchase those vaccines, because remember, we got this state support, the state funding came in 2002, one-time funding. We replenish it because those doses are paid back to us. So we get 100% of that funding back, but that pot has never grown. So as more vaccines come on the market, we just simply don't have, it's not sustainable to continue. So, okay. So to that end, the model needs modernizing. Like I said, we've reached this tipping point where it's no longer sustainable. We don't have enough funding to be able to continue with that billables piece for vaccine access program providers. And the VFC only clinics are also potentially in jeopardy because of the rising cost of vaccines and the policy for them to carry two stocks. So we've been sharing this information. We've been talking with partners and different groups around the state to explain sort of this is our challenge. We were able to get some funding to carry us through the next 12 months. That's great for this respiratory season, but then we'll be at the exact same place. So we really have to just change our finance model. And again, it's connected to access because we lose providers, kids have fewer and fewer places to go. So we're planning a vaccine financing summit for later this fall. And the goal is really to just get all partners in the state with a stake in sort of healthcare and immunization specifically in one space so that we can share all that we can and really just foster an environment for discussion and ideas. It's important to point out that this isn't an OIP, Oregon Immunization Program problem. It's a systems-wide problem. And we really need a systems level solution. And so that's why we need everybody talking about this who has any sort of stake in the topic. So we're looking for a system solution. We'll just continue to work towards that and see how folks can come together and partner to identify a potential solution. So I'm gonna stop there and ask if you have questions. Dr. Hassan.
Wait.
Oh. Yay. Thank you, Susan.
I didn't get it worked out.
just wondering on the prior slide that 46% participating in the here, but is that percentage of all vaccinating clinics in Oregon?
All clinics enrolled with the state supplied vaccine program, so VFC or vaccine access program. Yeah.
And do you know how many of the total clinics in Oregon that represents? What proportion?
Oh, in terms of how many clinics are we unaware of?
Included?
Yeah, that's a really hard bit of data for us to know what we don't know.
That's what I figured. but-
Yeah.
All right, thank you.
Yep. Other questions? Yes.
Really informative.
Oh, hang on one second.
Go ahead. Really informative, Kelly. I wanted to go back to one of, and you don't have to go back, one of Stacy's slides. So I can't remember the percentage, like 25% of schools are at risk for a measles outbreak because of being under the
Right.
herd immunity. Does Kelly have, or I'm sorry, does Stacy have a mapping of those? Where are they located? Are they clustered in the state, or are they kind of randomly distributed? Do you know?
That's a great question. I'm really glad Mimi's here as well because she's not aware either of the answer. So that's a great question. I don't know. So Stacy was thinking about joining the chat, and if she is, she will, I'm sure will answer that question. My guess, knowing Stacy, who has been focused on this work for so long, is that yes, she does know where those schools and clinics are. I just can't speak to that specifically. I do think that you can message attendees through the app, and she's listed on there.
I'll check it.
Yeah, feel free to.
The other bigger question about what you're presenting about vaccine financing and kind of the challenge we have in the state. I'm sure the CCOs are going to be at the summit that you're talking about. What about legislators? Are they part of this discussion, or is that another layer that needs to come?
Yeah, I mean, we aren't really sure what direction the conversation's to go. We want everybody in the room who has an interest and a stake in the health of children and really all Oregonians. So where that goes and what the group comes up with for solutions, again, it's systems level, and we welcome all participation in that.
I'm curious about the county health departments, why they are choosing not to provide immunizations. Because I'm seeing in some states, they're expanding their immunization programs, especially for adults now with Medicaid expansions, and with states that are expanding Medicaid regardless of their status. So, and I know Oregon's one of those states, so as more of those patients are covered, I'm just curious why the health departments are not vaccinated.
Yeah, it's a good question. We have said for a long time, if you've seen one health department, you've seen one health department. So the reasons are varied. It could be that there's, through their own assessment, that they feel like there's really great access in their community. It could be that it's a staffing issue. It could be that their Board of County Commissioners aren't as supportive, or they don't have general funds supporting their clinic. There are a lot of different reasons why that could be. Dr. Hassan?
Yeah, I can kind of speak to that for Clackamas County. I'm on the Public Health Advisory Council for Clackamas County, right? And, that specific question came up, and I think most counties are dealing with how to answer it. To what extent do we continue to provide direct access to vaccines, as opposed to assurance, which is making sure that those services are provided elsewhere. And so I was in the conversation deciding that, and I thought the question was a little silly. I think assurance means providing access when there isn't any, but that's not the reality of the way things are structured and the way the conversation went. In our case, in Clackamas, there's problems with the board of directors that the public health office has to answer to, not all of whom see necessarily the value of some of the work they're doing. For example, in Clackamas County, we recently eliminated the Office of Equity and Inclusion because a couple of the board of directors members thought it was discriminatory. They didn't listen to my strong letter telling me why they were wrong. So there's certainly some of those factors in place, but the idea of public health modernization is at play, where there's this push to try to perform public health in a way that we would like to perform, where like all public health does is make sure that everyone else is doing what they need to do. And at least what I saw in the conversation in Clackamas County was that they were trying to do that in a way that didn't make sense to me because we're not ready for that. You know, the public health departments, LPHA, should not need to provide vaccines. They should be provided elsewhere. But they do need to provide vaccines. And so I think for me, it was a sense of trying to get to this place where we want to be with skipping these steps in between.
Could I just comment that this is a very complicated question. You know, most people don't know that Multnomah County, for example, is the largest, the health department runs the largest FQHC clinic system run by a health department, probably in the country. Whereas talking about the low resources in public health, the idea for some health departments is not to evade the assurance of individual care, but to actually elevate the health department to what it offers in terms of public health interventions, which are not necessarily individual care interventions, but they're community level, which have the greatest impacts. That's a hope, but I also understand that not every community can have that. So most public health departments historically have been the safety net for many people, but we have also federal FQHCs that are funded to do that work. And I guess the best way is to really think about in each place, in each county, what makes sense for our communities. But we must have, and this is what we're lacking in Oregon, the staffing in order to do community level interventions, which often are well documented and evidence and have the largest impacts. And especially immunization, that's a great example because we have individual care and then we have these other things like the alert system, reminders, we have messaging, etc.
Yeah, I'll just say that I know that the public health workforce is struggling, took a pretty big hit during COVID. One of the, if you could call it a silver lining or a lesson learned during COVID and from the pandemic was the value and the ability to connect with community partners that maybe weren't being connected with previously. So community-based organizations who can speak with key leaders directly to their respective communities in ways that is culturally, linguistically appropriate. Partnerships with, other clinics or hospital systems in counties, schools. There was probably a huge increase in communication between schools and local public health during the pandemic. And so, yes, there's been a big hit to public health workforce, but I do think that if we can capitalize, leverage some of these lessons learned from COVID, then that will help. Now, the only follow-up to that is that our vaccine finance model doesn't allow the same lessons to be done, right? Federal government paid for COVID vaccine. Anybody could get it. You could go to a drive-through, you could go to a pharmacy, you could go to your clinic, you could go to the library and get vaccinated. Because of the fragmented system, the way that vaccines are paid for, financed, and the way the eligibility is so fragmented, that makes it very difficult. I think there was a question in the back.
Yeah, I had a question about the exclusion day and under whose authority is the student removed and how is it enforced? And does anybody actually get excluded?
Yes. Yes, it's in statute. Mimi, do you want to? Yep, it's in statute.
It is in statute, and I think that at least for our program, our staff and the county health departments, the goal is to never take a child's right to attend school away. So in Oregon, we allow non-medical exemptions, and explicitly for all the reasons we've talked about today and that Max and Dr. Hassan have talked about. Some parents are not going to get their kids vaccinated. Some of those because they can't.
Yeah.
And yes, kids are actually excluded. It happens every year. It's a big deal. Counties and schools work really hard to prevent that, but it does happen every year.
Right.
So yeah, mostly just for a few hours, and mostly it's a issue of missing records.
And sorry, one other follow-up. I just want the data that you have is leaps and bounds ahead of many other states, and so like it's great to see. And I think the way you presented the second dose of the MMR vaccine at only 74% of schools actually meet that, even though there's high, generally high immunization rates. Like I don't think I've seen that presented that way before, and like I think that's a great takeaway for other states. So I just wanted to commend you and thank you.
Thanks. Thank you, Stacy. Yes, there's a question here. Let's go here.
I'm just wondering if you have, anyway, and I imagine you don't, but when trying to, maybe change the way that we have funding and financing at a legislative level, you kind of have to be able to present, like, do you have any hard numbers of who's opting out because they don't have access and who's opting out because they have a belief system?
Yes,
that'd be tough to track, I imagine.
It has been really hard data to get a handle on. We do have a new project to try to assess just that. So, right. I can't speak to all the details, but yes, surveying parents who have those exemptions and whether they are due to access issues specifically or truly just opting out, not wanting the vaccine. Anything you want to add to that, Mimi? Okay. We're going to go in the back really quick and then we'll come up. Getting Susan her steps.
Are the vaccine requirements different for kids doing online schooling?
That's a great question. I don't think so. No, because they're typical. Well, I don't think so. Right. There's nuance, but mostly the answer is no. And then I think there was a question right up here too.
I got both. Nope, I blanked on it.
I can so relate.
I'm up. You sure? Okay. I was just noticing American Indian, Alaska Native population there. I was wondering if you could share a little bit about maybe both tribal health programs and how they fit into this model, or if they do, or if that's a whole separate stream, and then obviously urban natives and just service delivery for those communities.
Yeah. So there are several tribal health clinics around the state enrolled in state supplied vaccine program to provide VFC vaccine, there are some in the vaccine access program as well. I can't speak to specific data around that. I wish Rex were here because he could speak much more eloquently about that. I don't know, Mimi, if you have anything to add for tribes specifically in tribal clinics.
They're all enrolled. So all the tribal clinics and the IHS clinics are enrolled, as well as the urban Indian clinics. And it's kind of like a county. If you've seen one, you've seen one. We prioritize our relationships and our service to those folks, and it pays off. Is that what you were after?
Thank you. Mimi, you could just come sit up here if you want to be on my panel.
Thank you. Sorry about that. I know there's a whole process going on for OHA to come up with legislative solutions and community-based ideas and things like that, but do you have buy-in from OHA leadership to try and actually pursue policy changes at this point, or is it sort of just information gathering?
Yeah, we're actually not honed in on a solution. We don't know. We know that we need partners around the state to identify the best solution, so we're not driving towards anything. What we're looking for is information building, right? Understanding of the issue and really leaning on our partners around the state to help come up with a systems level solution.
But is there a backside to that? Like, I'm a lobbyist, just so we're clear. I work for American Cancer Society, and so I'm always like legislative focused on these things. And sometimes I've noticed that OHA has brilliant people doing great process, and then leadership doesn't buy into the process that they had. For example, there was a flavored tobacco bill that advocates introduced, and there was a flavored tobacco bill that was supposed to be introduced by OHA, and the governor said no. So knowing that you don't have solutions right now, but there are going to be solutions at some point, have those conversations started happening at the leadership level?
We've certainly shared all of our, this whole vaccine financing challenge. They're very much informed on the challenges that we have. Yeah. And, if you have any other questions, Cynthia, I don't know if you have, she's the best resource to reach out to.
We have a question from the chat.
Oh, great.
Just a little read that out loud.
No problem. Jay Wong of Clatsop County Department of Public Health asked, as the state passed a law to be the first single-payer state in the nation, can we follow this potential to find new ways to fund all vaccines for all age residents in Oregon?
That's we would love that solution. That's why we're trying to bring everybody together later this fall, date to be determined, likely late October, early November, to have those conversations and talk about, we can talk about what other states do. We can talk about what makes sense for Oregon. We can talk about who is at the table and can help identify those solutions. But that's all TBD.
I wanted to give a little context to the tribal clinics. When I was with the immunization program, I actually visited all the tribal clinics in Oregon, and I was really impressed with the work they do. Now, tribes are, by treaty, have sovereignty, so they can talk directly with the federal government, and there's relationships with the state that people have worked on. And I've got to say that they're really doing a great job with the resources that they have. I also wanted to say, because I'm not working for the state and I'm not in government, that there are some key people, and I'll just say this openly, that we need to let know that there's a problem. And one of them is the chair of the Ways and Means Committee in the Oregon Legislature, Dr. Elizabeth Steiner Hayward. She is an advocate for immunization. She was one of the ones that was trying to alter the law that allows non-medical exemptions, and she was actually threatened to it. But she is a physician, and I would definitely sit down with her in some way, maybe through your legislative liaison, because I know if you're working and you have your work hat on, you can't speak as a state or governmental person, but you can as a citizen after you take your work hat off. And I encourage, what I talk to legislators, and I know there's a session coming up, but about advocacy, you can and you should be talking. When I talk to legislators about public health, regardless, they say, where are you guys? We never hear from you guys. And that's because of the fear of losing your job. But you can't lose your job if you don't have your work hat on. So please talk to your legislator.
think that is a great segue to the following sessions, Kelly, unless there's anything else you wanted to end on.
No, just thank you. Thanks for, for listening to me be three people and to hopefully carry their data well. I appreciate it. And please do reach out with any further questions. Thank you.
Thank you so much. Thank you for being three people today. Thank you for being three people today.
Of course.
So now what we're gonna do is we do have lunch. It's out there, I promise. It's where the food was earlier this morning as well. We have about 20 minutes for y'all to get lunch, take a break, and then the plan is to come back and eat lunch in here while we hear from our keynote speaker. So I'll release you all and we'll meet back here at about noon, I think is the plan. Introduce this speaker. We've been talking to him for, I'd say probably about a year now, maybe. I'm not really sure exactly when we got connected, but the work that he's done has been really important, and we've been really excited to bring it here to Oregon. North Saunders brings 15 years of leadership, grassroots organizing, and fundraising experience to Safe Communities Coalition. He has worked on the local, state, and national levels for numerous political campaigns, candidates, and advocacy organizations. In 2019, he was encouraged by his partner, a pediatrician, to testify in support of removing non-medical exceptions to the vaccine schedule for students in Maine. He was galvanized by the strong opposition to the legislation and joined the volunteer organization Maine Families for Vaccines to support the effort. He led the grassroots citizen lobbying effort that saw the successful passage of the legislation. When the opposition attempted a referendum to use a people's veto and overturn the legislation, he served as volunteer political director for Maine Families. North oversaw the creation of a state PAC, hiring of campaign staff, and coordination with political allies. Maine Families celebrated a resounding 72.4% victory at the polls, and the legislation was upheld. He's excited to bring his passion for fundraising, grassroots organizing, and pro-science advocacy to other states across the nation. Please help me welcome North Saunders.
Thanks so much. I didn't realize you're going to read the entire bio, because that's a lot of what's in my presentation. So excited to talk about it. But thanks so much for having me here. It's my first time in the Salem, Portland area, and I actually live in Portland, Maine, and I'm just very excited to be here and experience the other Portland. So we're going to talk a little bit about anti-vaxxers, and I call them anti-vaxxers. We're not talking about vaccine hesitant parents. We're not talking about people that are a little skeptical about vaccines. We're talking about people that are actively working to undermine the pillar of public health, which is vaccines. And so what we're going to talk a little bit about is the background of my organization and the work that we do. We're going to talk about anti-vaxxers, how they are different in the post-COVID world, and then talk about our successful work in other states, how we built advocacy chapters and passed good legislation and stopped bad legislation from advancing. And then talk about the opportunity here in Oregon. It's great to see this conference and have all of you here to learn more about how we can increase advocacy efforts and make a difference. So I'm not a vaccine expert. I know generally what vaccines are required for school entry. I know a little bit about vaccine history and manufacturing, but I am a political campaigner. Most importantly, I'm a parent. I have 3 kids, ages 7, 6, and 3. And I'm like, the reason I got involved, as Meg said in my bio, I was just kind of blown away that the anti-vaccine movement and their distrust in science, like it overwhelms me when I think about it. I'm also a proud Mainer. I enjoy foraging for mushrooms and other wild foods and backcountry skiing. And I'm excited to be out here in the Pacific Northwest. Like Meg said, so our organization has 2 parts. The Safe Action Fund, we're a 501c4 organization. So we're a nonprofit, but we're not a charity. We do advocacy and we get things done inside the State House. We also have a political action committee, which means we support and oppose candidates directly for public office. And this is a map of where we're working. So our organization is about 3 years old. We have 8 chapters. We call them state Families for Vaccines. And so Maine Families for Vaccines was obviously the first one when we got involved in 2019. And what we do is we help advocacy efforts go the final mile. And that's why we're here in Oregon, is to help see what we can do, lend our expertise, and help you guys advance a pro-vaccine agenda here in the state. Everyone that works with us, we're all parents. We have led pro-vaccine advocacy efforts in our home states. We've worked on campaigns. We have knocked on doors. We have manned phone banks. We have recruited and trained people. We've run social media campaigns. We've done large ad buys on TV. And so we bring that actual campaign experience to the folks that we're working to help. Because we're a C4, we allow our partners to work on education and outreach, the traditional 501c3 activities. And really what we know from our wins is that when you put parents front and center, that it makes a difference and it gets lawmakers' attention. So let's talk a quick history of anti-vaxxers. Who knows when the first anti-vaxxer started working? It was the smallpox vaccine in the late 1800s. So they've been organizing for well over a century. You can see this political cartoon where anti-vaxxers are just walking others off the cliff, because that's what they do. The Supreme Court upheld vaccine mandates in Jacobson versus Massachusetts in 1905. And at the end of the day, the anti-vaccination movement, it's not just a social movement, it's a political movement. They use political strategies to advance their agenda. And it's also a little bit of both, right? The anti-vaxxers, they create a welcoming environment. They build community, they make people feel welcome, they make people feel heard, they make people feel understood. And I think I already said this, there's a big difference between someone who's vaccine hesitant and someone who's a dedicated anti-vaccine activist. I think in all of our conversations, we need to keep that in mind. We approach every parent and every person with empathy. We start with empathy, we start with listening and understanding, and that then we either go political at them and stop their political movement, or we educate them and bring them into the fold as a accepting vaccine giving parent. The modern anti-vaccine movement was kind of born with Andrew Wakefield and his study around autism that was published in the Lancet in Great Britain. And that's what kind of galvanized the new era of anti-vaxxers. He attracted folks like Jenny McCarthy, and they really built in the mid to late 2000s this movement of distrust in vaccines. Green our vaccines, make them safer, make them more environmental. And then came the kind of the rise of Del Bigtree. Show of hands, who knows the name Del Bigtree? You don't need to know him, because he's a grifter and he raises money from parents that are vaccine hesitant that fund his operation. We recently learned that if he's going to come speak in your state, he requires a $10,000 speaking fee. RFK Jr., Bobby Kennedy, pretty familiar with him. And I think generally they're a symptom of growing alternative medicine, them profiting from distrust in science and vaccines. And I think Dr. Cohen said it earlier, one of the most influential voices in vaccine misinformation is a physician. A lot of physicians have found a profitable business model by sowing distrust in vaccines and offering alternatives. COVID-19 changed everything. We saw a big difference in the number of people that were actively promoting vaccine misinformation, actively advocating to change our laws to make vaccines harder to get, and just sowing distrust in science. It really is a brave new world in terms of vaccine advocacy because of it. We were making great progress pre-pandemic in strengthening our vaccine laws. In Oregon, you guys tried to remove non-medical exemptions pre-pandemic. It was a complicated political environment, but we were moving in the right direction in terms of getting more shots in arms and keeping more kids safe from vaccine preventable diseases. So I want to talk a little bit about vaccine legislation and what's changed. It's gotten crazy, right? This is nationwide, and just dealing with the pure volume of paper and sorting through 1,500 pieces of legislation, understanding what it does, who sponsored it, who's moving it through the legislature. Like, we are on our heels, and we've been on our heels since the start of the pandemic. Some types of legislation that we've seen since the pandemic, there were bills that would create a protected class and even criminalize discrimination from not wanting to serve someone because of their vaccine status. And I think here in Oregon, there were a couple of bills that were defeated this year that wanted to create that protected class. We saw legislation that would prohibit vaccine mandates and expand exemptions. We saw legislation that would stifle scientific innovation by limiting new technologies and research. We saw a bill in Louisiana that was called the Vaccine Abortion Connection Transparency Act, where they wanted to make providers educate parents about how the MMR vaccine was developed using aborted fetal stem cells back during its creation, and just generally sow distrust in vaccines. We killed that bill, by the way. Vaccines have become political. That's the long and the short of it. The anti-vaccine movement used to be made up of both the far right and the far left. Now it's primarily the far right. I was having a conversation with someone earlier here. It's because the far left, when your anti-vaxxers are also neo-Nazis, they get a little bit uncomfortable. And so we've kind of seen the solidification of the anti-vaccine movement on the far right. There's still plenty of left-wing Democratic anti-vaxxers, but generally the movement's been driven from the right. They've joined up with conservative groups like Moms for Liberty, and they're stronger than ever before. But because they have joined up with the kind of far-right coalition, they get distracted pretty easily. So you want to talk about guns, they're going to come out for guns. You want to talk about trans rights, they're going to come out against trans rights. They're going to come out on banning books, school issues. And so while there are more of them that we can kind of consider politically anti-vaccine, they aren't necessarily as effective because they are so concerned about other issues. And let me say this, if you have questions at any point, like I'd rather it be interactive, so just jump right in.
Great. Well, so a very quick question is, it used to be both far right and far left. Publicly, advocates seem to be primarily far right. But do you know if this is changing hearts and minds at home for the former far left anti-vax people, or are they just quiet and not coming out to rallies anymore?
The short answer is I don't really know. But like they're less hesitant to show up, and therefore their political clout is diminished. It would be my hot take on it. I also want to note that there were anti-vaxxers at the Capitol on January 6th. They had their own separate little rally, and one of the anti-vaccine doctors was sentenced to prison for participating. It's crazy. We also have an anti-vaxxer running for president. You can see here Bobby Kennedy, who I consider the nation's leading anti-vaxxer right now. It's polling pretty well. Now, this is generally Americans. It's not Democratic primary voters where he is very much underwater, but there is a large portion of the population that have a pretty good perception of him. He's floundered lately because traditional media outlets aren't amplifying his anti-vaccine messages, and I think it's great. But anti-vaxxers are drawn to him. They're giving him money. His organization, Children's Health Defense, had $15 million in the bank 2 years ago. We don't know how much money he has now, but he's certainly raising money hand over fist. And the way he's going to galvanize his voters is by supporting legislation during the presidential primary season in state houses around the country. And so, I don't think he's going to be the next president of the United States. I don't think he's going to be Joe Biden in a Democratic primary, but he is making more anti-vaxxers have a voice inside state houses. How politically active is this room and online? Do you vote? Do you contact elected officials? Why don't we have everybody stand up really quick? And we're going to stand up really quick. I'm sorry, we're gonna make this interactive. So I want you to stay standing. If you vote, you generally consider yourself a voter. Great, that's very exciting. Take a seat if you didn't vote in the last election. So I think here in Oregon, there were school board elections in May. Did you all vote in the school board elections in May? That's pretty good. That's pretty good. How many of you know your elected officials? If you can't name your state senator and your state representative, take a seat. Wow, this is good. This is good. This is better than I thought it was, because before I got involved in state advocacy work, I certainly couldn't. take a seat if you haven't contacted them. So stay standing if you've contacted your elected official about an issue that matters. Great. This is actually very heartening. So stay standing if you've been to the State House to testify or attend some sort of advocacy event. Oh, this is great. Like, thank you. Like, I'm feeling a little bit better about our state of affairs. So thank you. You know, I'll take a seat. That was good to know, right? That makes sense, right? This is a vaccine advocacy convention, so I'm so glad that there are so many advocates in the room. But really, how politically active are they? They flood the phone lines. If you talk to a legislative staffer, they will complain about the number of phone calls they get, the number of emails that they get. We're certainly not flooding anybody's phone line. We're not flooding anybody's inbox. We're making our voice heard, but it's not enough. They turn out people to the State House. You know, I imagine during 2019, when you were trying to remove your non-medical exemptions, they had rallies. Were there 5 people there? Were there 50 people there? Were there hundreds of people there? I'm guessing there were hundreds of people there, because that's what they do. They turn people out. They're well organized and they're well funded. They've successfully stopped the vaccine agenda in Oregon in the past. And so there are 25 bills that were heard that, you know, we tracked as our organization here in Oregon last year. 23 of them were generally anti-vaccine. 2 of them were pro-vaccine, and they passed. That was to expand access to vaccines by allowing pharmacies to get more shots in arms. So great work. But still, 25 bills, that's a lot of work. Like, I don't know if many of you work across state lines, but 25 vaccine bills is a lot. It's a lot to keep track of. And I think, you know, I mentioned this earlier, but discrimination was a big theme in what I saw in the legislation that was heard. So what we can do, what can we do to change the narrative, to push back against the anti-vaxxers? So I'm gonna tell you a little bit about the work that I first got involved with in Maine. I mentioned I'm a parent of 3, and my wife, she's a primary care pediatrician, and she saw a lot of vaccine hesitancy in her own clinic. I thought vaccines were kind of like a wonky niche issue. You know, I worked on Obama's campaign. You know, I helped human rights campaign for marriage equality. It's like vaccines seem not really that important. But then I showed up. My wife asked me to go testify. I showed up. There were hundreds of anti-vaxxers there. The committee hearing went until 2 in the morning, and they were well informed. They knew how the process worked. Like, I had thought anti-vaxxers were, you know, your homesteaders that brewed kombucha. They like foraging too for herbal remedies. And so there was a need. The reason that the legislation was introduced is there was a need. Maine had the worst in the nation immunization rates for pertussis. There were outbreaks in schools and daycares of pertussis, varicella. See, I know a little bit about vaccines and science, chickenpox, mumps, measles. And so the powers that be, the AAP, the Medical Association, and others got together and found a sponsor of a bill to remove non-medical exemptions in our state. We had both the religious and the philosophical non-medical exemptions. So we made a plan. We knew that if it was just the doctors there, that we wouldn't really get attention of the lawmakers. We needed to make sure that there was strong collaboration from a very diverse group of people from the very beginning. And rather than having it be headed by the AAP, you know, a pediatrician in a white coat, we wanted it to be a grassroots movement. You know, I'm a grassroots dad. We wanted to have an organization that was, if in name only, was a grassroots, parent-driven organization. So we created Maine Families for Vaccines. My coworker created the logo, which you'll see here in a little bit, you know, at like 10 o'clock at night using Canva. You know, it was truly like a grassroots group of people that was working alongside our friends, the pediatricians, and all those other great groups to pass this bill. We really leveraged our State House connections. We had a lot of people that were politically savvy, so we were friends with the chief of staff of the Speaker of the House. And so we knew who we needed to put pressure on politically. We really leveraged them to the fullest degree that we could. We recruited from our networks. We had a communications plan. It was a grassroots group of parents, but we made sure that we were cultivating relationships with reporters so that they would place our op-eds when we wrote them. We had a communications plan. We did communicating legislatively. And so that was like the big work that I did, was that we built a whip list. We figured out who we needed to move and how we could move them. I went out and I called everybody I knew. I grew up in Maine. I called everybody I knew in Waldo County and said, do you know anybody that cares about public health and vaccines? Because I need them to come meet with this state senator. I need them to show up to the State House to get this meeting, to get their vote. And it was about reframing it. It's not just about science. It's not just about vaccine manufacturers making a profit. It's about keeping our families and our kids safe. And it worked. We got it passed by just one vote. There was a referendum. We don't need to talk about it here, but we overwhelmingly won that referendum. 73% of Maine voters supported pro-vaccine legislation. Like that's a huge win, right? When you talk about winning an election, 2 points here, 3 points there, it was a big spread. And then not only did we pass the legislation, but it actually improved immunization rates in our state dramatically. So in 2018, just before the legislation was introduced, we had a 6.2% exemption rate. In 2021, when the law was implemented, it dropped to 1.8%. Last year, it dropped to 0.8%. That's my daughter. She was 2. We were inside the State House a lot. It was a lot of fun. And that's what lawmakers see kids. They're like, oh, why are the kids here? Oh, because we want to keep them safe from vaccine preventable diseases. So she was 2 when we passed the law. She started kindergarten right when the law was passed. That's why we do this, right? It's to keep our community and our kids safe from vaccine preventable diseases. It's not all rosy though. So Louisiana, they had 39 anti-vaccine bills introduced. This was in 2022 at the height of COVID, or of COVID backlash, let me say. So they reached out to us and said, hey, it seemed like you had a good idea in Maine. Let's brand it. Let's make it family friendly. Let's make sure that we are using good talking points and we have a good political strategy. So we created, surprise, Louisiana Families for Vaccines. We did their brand, their website. This looks like a mom could have created it at 10 a.m. or 10 p.m. Like it was a mom. I wasn't at 10 p.m. because we've kind of professionalized, but it disarms lawmakers. It disarms the anti-vaxxers when you have something that's cute and that resonates. So we built their brand, their website, their social media, print collateral, and then we went out and recruited. We had a couple of lead advocates, but we needed to build a team around them. We trained them. How do you call someone and ask for their help? You built a script, and we did that for them. We did all the sorts of things that a traditional grassroots campaign does. We built a very highly engaged email list and a strong following on social media. We showed up to the Capitol. Like honestly, half of this is just showing up. When lawmakers see people in t-shirts, they're gonna pay attention. We had a social media campaign. We raised some money to acquire people online. And then we had strong collaboration with allies. The AAP was there, the Louisiana Vaccine Alliance, the State Medical Association, and other advocacy groups. And I can't stress this enough. We reached out to a group called the Power Coalition for Equity and Justice that deals with poverty and other social issues. They were there with us. They showed up to our day of advocacy. The Autism Society in Louisiana recently joined our work there. And so it's about engaging with these non-traditional groups as early as we possibly can. We also had faith leaders. The Catholic Church was there supporting our work. And so that changes the tenor, particularly in a state like Louisiana, when it's one of the most Catholic states in the country. Like to have the Catholic Church say, we support vaccine policy, it makes a big difference. So we had a great day of action, 40 attendees. 40 attendees, it's not 500, but it's certainly more than none. We had many one-on-one meetings with lawmakers, including the Speaker of the House. We developed and distributed floor sheets and legislator guides to vaccine legislation. We testified. We showed up and testified and had a presence in the committee room. One of the bills of those 39 that we defeated, the chair saw us all walk in with t-shirts on and said, "Whoa, what's going on here?" And that delayed the committee hearing. Like, they were going to wrap it up, but we were all there. He said, "Oh, we need more time for this." That delayed the committee hearing because they had to go back for a floor vote, and then the calendar ran out. So we used like a tactic, like a kind of a sneaky legislative tactic to kill a bill because we just showed up. We were on TV, we did tabling, we had a press conference and a photo op, and then, you know, a great group of allied organizations. We started in March, we killed all the bills by June. It was 3 months of work, but it worked. So of those 39 bills that were introduced, only one made it through. It was very COVID specific. Unfortunately, the governor vetoed it. They submitted written testimony, they would weekly calls to action with the email list, testified in person on 12 bills, and developed a floor sheet. And so as we run these campaigns in these states, we now have a library of these things. We don't have to go out and create talking points. You know, we have to create, you know, every state's different, every campaign's different, but we now have a library of all these handouts that we can easily modify for lawmakers. And I get ahead of myself here, but yeah, the presence of the advocates delayed a bill, causing it to die on the calendar. And now our lead advocates, they now have their own 501c4, their own 501c3. They just raised $20,000 from the Children's Hospital of New Orleans. They're out there because we invested in their advocacy efforts. They want to keep doing it. And so much of this work is about building a community of advocacy. So takeaways from our success. We got to reframe the debate. Like most people here, like, we're medically adjacent. We kind of, you know, work in this advocacy space. We need to make sure that front and center, it's about families and keeping our communities safe from these diseases that we've nearly eliminated in this country. The brand identity, it really matters. Like, and I should have probably had an example. The anti-vaxxers, they love their American flags. They love kind of harsh. They're here to fight back and stop us in the pro-vaccine world from advancing our agenda. Keeping a family-friendly and a family-friendly tone, it really disarms people. We were inside the State House in Tennessee, and we showed up with our cute T-shirts that their brand has ladybugs on it. And the lawmakers were like, "Oh, who are you? This is so cute." And we're like, "Oh, we're here to advocate for vaccines." They're like, "No way. Normally the people come in here and yell at me." So being the antidote really makes a difference. Like, if you're friendly, you can get so much done. Like, if you're friendly to a committee chair, they're going to tell you the information that they're not going to make public. They're going to say, "Oh yeah, the committee is going to run 3 minutes of testimony. We're going to do 6 pro and 6 against," and you can get that information, and then you can build a strategy because you were just nice to someone and they like you. You got to collaborate with the non-traditional organizations. So here in Oregon, we need to do some work to find who cares about their communities. Everyone. How do we find their leaders? How do we engage with them? How do we demonstrate that this sort of work matters to their constituencies? Got to talk to the religious groups, got to talk to the less represented populations. Business, big ag, big employers, those groups carry a lot of water inside the State House because they give a lot of money. But if you can align with their goals of doing good work, keeping their employees safe from disease, they're gonna be a strong ally. The public hearings are always a circus. I've been to some hearings recently. It feels like the anti-vaxxers are a little bit deflated. They thought COVID was their moment and they were gonna roll back vaccine laws and they were gonna change everything. They're not winning. They're certainly not losing, but they're not winning. And so I think they're a little bit distracted with their other, social issues that they're focused on. But it's still going to be a circus. They're still going to show up. They're still going to get in your face. But if you're wearing a cute T-shirt, they're a little bit less in your face. It shouldn't be, but it's a political and it's a partisan issue. You got to work closely with allied lobbyists to allow for targeted action and success. We're not going to turn out those hundreds of people. So we need to know what lawmaker is with us, what lawmakers against us, and who knows that? The lobbyists. The lobbyists for your medical associations, your lobbyists for your vaccine manufacturers. Their information allows you to be much more targeted. You got to cultivate relationships with lawmakers. You guys are all mostly still standing. You know your lawmakers. Like, you got to show up to their house parties when they're running for re-election. You got to be there and be like, "Hey, Joe, you know, it's North, your neighbor." And, you know, but like really, like those sorts of relationships go a long way. But at the end of the day, they're not going to stop. The anti-vaxxers are going to continue fighting, and they're going to continue to drive their agenda. There are advocates just like you. Like, we're here to build this into a national movement. You can see the, you know, up here, ladybugs, pelicans, boring original one in Maine. We got bears in Montana. This is a great group of a partnership. These are all March of Dimes advocates that came out in Massachusetts to talk about vaccines. March of Dimes, you know, was created around polio. They have a much broader agenda now, but like, we're partnering with them. They're showing up. And so there's not like a secret sauce here. You show up, you have good materials, you know your political strategy, and you can win, because at the end of the day, the majority of Americans vaccinate their kids. The majority of Americans believe in science. We just need to find the right message to those polarized lawmakers and bring them back to the center. So again, this is our map. Like, our organization is only 3 years old, and we're pretty proud of the work that we've been able to do. Spent a lot of time cultivating relationships. We're here to listen. And I think we first started talking to Jake here 2 years ago, maybe even 3 years ago, I don't know. And so like, our agenda is your agenda. Like, we're here to support you, like figuring out what those policy solutions are, and then layering on our campaign experience and our strategies from other states. When you win, we win. Like, I'm just a dad that cares about his kids and keeping other kids safe. And so it makes me excited that there's so many advocates already engaged here. We help build capacity, right? Like, we designed this logo, the cute beavers, to help jumpstart some additional advocacy here. Like, you guys are doing a great job, but we're here to help do more advocacy. Every state's different, but we've got to share the takeaways from the wins and the losses. Those talking points, those strategies that we've already successfully used in other states can be applied here. We help deliver results in the final mile. You know, we get calls from states like North Dakota had a horrible bill where they wanted to ban all mRNA vaccines, and like, we don't even know where to begin. But we helped that. We had talking points. We were able to deliver it and help them get it over and kill that bill. And it's not coming back because they are only in session every 2 years. We're not here to make anything more difficult. We're just here to assist all of you great advocates do even more great work. And make it fun, right? Like, if you want to hang out with people that are here having a good time, I'm having a good time. You know, I'm excited that I got to come out to the other Portland and meet all these great people. Like, this has to be fun, or people aren't going to want to do it. And so we've been working with Meg and Immunize Oregon to build Oregon Families for Vaccines. We have some ideas about things that could be done. I think showing up in t-shirts in the State House is a great place to start. Just a day of advocacy, talking to people, talking to lawmakers, saying we are the pro-vaccine majority is a great place. In South Dakota, their State House is like in the middle of the state and no one lives there. And so in Sioux Falls, which is the major city there, we have postcard writing happy hours. People get together and like have a beer or a glass of wine and write postcards to lawmakers. That's what the anti-vaxxers do. They have like this great social agenda that they're able to advance. And so it's about having fun and having a good time. So we have lots of ideas on how to help. And so we're here to build a sustainable grassroots advocacy network in every state. And so I'm really grateful, like that's our entire mission as an organization, is to help people become vaccine advocates. So I'm really grateful to Immunize Oregon, to Meg and Jake and everyone else here in the room. Like, thanks for having me out. Like, I went to the Japanese gardens yesterday and like got off my plane and it was like beautiful. So thanks for that. That's all that we accomplished. I now have a greater appreciation for Japanese tea gardens. But no, really, like it's fun to be here. It's fun to be in a new state, and we're excited to help. So are there questions, thoughts? Like,
what was the makeup of the legislatures where you had success? What was the makeup of the legislatures where you had success, and let's start there and work back. It was bipartisan, I guess.
It's really hard. It's really hard to find a pro-vaccine Republican lawmaker that will publicly support anything right now.
Okay.
And so in the states that have removed non-medical exemptions, again, that's just like what that state wanted to do in response to their situation. And so while we support those efforts, that's not our agenda. You know, we're not here in Oregon saying we got to revisit 2019. But in the states where we've removed non-medical exemptions, it's been Democratic trifectas. And so California, New York, Connecticut, Maine.
So both houses and the governor.
That's right.
Okay.
But we can go back here and look at this map here. You know, we have chapters in very conservative states.
Yeah.
You know, I don't know if anyone's followed what's happened in Tennessee recently, but it's been a political mess around gun issues. And so they're also not particularly vaccine friendly, but you know, when you're described as a breath of fresh air inside the State House with your Ladybug t-shirts, like you're getting somewhere. And so we'll work in any state that wants to have us. You know, a coworker likes to describe ourselves as vampires. We have to be invited in. Like we're not going to like come pound on your door being like, oh no, you need to do this. It's like we want to listen, and like that's why I'm excited to like hear the policy conversation and like what do you guys want to do and like how can we help you do that.
One comment I wanted to make, I was interested to learn about the one bill that was trying to make unvaccinated people a protected class, and that resonated with me pretty hard because that would have been through the Equal Protections Clause, the 14th Amendment. That's one of the Reconstruction Amendments designed to prohibit discrimination against former slaves and Black Americans and marginalized communities more broadly. And that example you mentioned is just one I hadn't heard of, but it's one of many examples that of how the conservative legal movement has used tools of Reconstruction Amendment specifically, but also civil rights projects more broadly to advance usually white supremacist agendas, which anti-vaccination is pretty broadly, I think, a racist movement, even though there are people of color who are anti-vaccine. The movement is based in, individualism over community, which is a project of white supremacists trying to break down the sense of community that binds us together. And that's why we have disparities in health outcomes, because instead of seeing each other as equals, we see each other by race. So a comment I wanted to point out there, because I think it's important to have that context. And kind of on top of that, you'd mentioned that people who in the anti-vaccine movement now in the far right has been distracted by all of the other issues on that agenda. And the question I have for you, I'd like to hear your thoughts on, is that I see that as a strength of right-wing America, is that they have created a social movement that is grounded in, I don't really know how to define it, but they have this sweeping push that every single person within it is trying to advance all of these different ways to essentially undermine our civil liberties. And vaccines are one of those problems, but so is, trans rights, other marginalized communities' rights, advancing, or opposing green initiatives. So all of these ways that we are suffering, and because of this movement, in response, we have very siloed responses where, well, we're focusing on vaccines, and there's Greenpeace focusing on advancing climate justice, and there's the Brady campaign on trying to reduce gun violence. And I wonder if it might not be more helpful to take a more holistic approach and break down some of these silos and acknowledge that actually at the end of the day, all of us are working for the same thing, which is just equity in our society and social justice at large.
Yeah, and I think that's a problem. I'm not sure how to solve it. I think the idea that, well, I think you hit the nail on the head, but I don't know how to solve it. And I think if I knew how to solve it, then we'd have Democratic majorities in most legislatures. And so, but we're nonpartisan.
Well, and right, Dr. San, what I think we heard earlier is that there are still probably in their hearts and minds more anti-vax or vaccine hesitant on the left. And so it makes it harder to, and I just know from doing some of this outreach and trying to break down those barriers and bringing some like-minded groups together, is that there are some groups that it's not that they're anti-vax, but because some of their constituencies or members are hesitant even, they just don't want to get involved. And you don't see that as much on the right. So the answer in my head is help us break down some of those barriers with some of these groups and convince them that this is really an important issue to engage on. Because that I think is where we've struggled, is there are some groups that's not their main focus, and they don't want to alienate the people that they serve.
I have two other thoughts. And so I think the first of which is, I'm attracted to this work because I feel like the medical establishment in particular doesn't know how to organize political campaigns because either they don't want to, or that's outside their purview or whatever. And so empowering providers to strengthen their voice and give them the tools to be successful, I think that is exciting. And it's exciting to the groups, like the environmental movement, marriage equality, all those other groups have very good campaigners that have been working on these issues for a long time. And I think it's exciting to find a new group, a new constituency, and empower them and get them excited. And I think by doing that, and by most importantly, making sure that we bring in those allies as early as we can actually start to break down those barriers. And so if, we're gonna have a policy conversation next, and we have a great policy idea, and then we're like, great, let's go advance it. If we don't go to all of the other communities and constituencies and make sure that there's not a problem there, that we're not missing something, right? If I look around this room, it's pretty white, all right? They're not at the table right now. We're not talking to them. We're not talking to those other communities. And so if we're going to come up with a great idea that's going to solve all of the vaccine problems in the state, is it funding beyond the next 12 months? I don't know. We need to make sure that we're going to those groups and identifying them and bringing them in. And I think that goes, if we're not solving the big problem, we're at least not creating more of a problem as we advance our own agenda. So I don't know, if we could solve the problem that you identified, I think it would be great, but I don't know how to do that. Other questions?
Go ahead.
Who's the point person for Oregon?
Hopefully someone in this room.
Okay.
Right now it's Meg.
Okay.
Honestly, the way that we found our state level directors is by networking into them. And so we have great people that are kind of the head, they sign the emails from our other state chapters. We found them because we went to our traditional allies and said, you want to increase advocacy efforts, find us a person that can help do that. And some of them are, one of them is a retired pediatrician. The other is a mom looking to get back into the workforce that's married to an emergency room physician. It's different in every state, but we need to find that person that has some desire and then give them the skills and the tools to be successful. So I think you're probably asking who do we put people in touch with?
Yes, that's one question. So thank you, Meg. The other question is, where do you guys get funding for all the materials, all the t-shirts, the websites, all that kind of stuff?
Yeah, so we have a diverse group of funders. Primarily it comes from the vaccine manufacturers, but we have a small donor program. We have a couple of family foundations that are funding us. In some other states, the AAP chapter has given us money, or the Medical Association. In Louisiana, it was a children's hospital. And so 3 years old, the startup, I like to think that the startup funding came from the vaccine manufacturers, but as we demonstrate success and we become further involved in the communities, we're doing fundraising within the communities that we're serving.
Thank you.
I do have to go ahead and, sorry, I'll let, Jamie, you can ask this last question. I think we got to close up and get out to a break. But to just very quickly expand on Brian's question, yes, come see me. Please come see me if you're interested in getting more involved with the Oregon Families for Vaccines.
Awesome. In Oregon, so I'm a lobbyist for the American Cancer Society. There's an interesting dynamic on healthcare related things in which a lot of times providers are on one side of the table, insurers are on the other, and the pharmaceutical producers are sort of, I guess, on the other side of the table. And it's like a constant fight there. What does that dynamic look like in the states where you've had success?
We've had a lot of, not trouble, but very little success getting the payers, the insurers, to come to the table. They gave us some, I think one health insurance company gave us some money in Maine when we ran the referendum campaign. I'd say generally in nearly every other state that we work in, the vaccine manufacturers and the providers are generally aligned. And, you know, we're kind of agnostic when it comes to like, does this benefit the providers or does this benefit the vaccine manufacturers? Does it benefit a particular vaccine manufacturer? Like, the goal is to increase vaccine confidence through legislative outcome and protect our communities. And so, like, I talk to vaccine manufacturers, but I don't know what they make. I mean, I generally know what they make, but like, if they're like, oh, we have this new product, I'm like, yeah, I don't really want to have a conversation about a new product and legislation that's going to benefit your product. I want to talk about getting advocates to the Capitol that's going to broadly improve immunization rates. And I recognize that that's like a slippery slope, but like, we try to be agnostic and generally public health focused with the outcomes that we want to advance.
Thank you, North. Can we all give North a big round of applause? Thank you so much for coming out today. He actually flew out from Maine, as he said. It's a very long flight. If you have any other questions for North, I believe he's actually staying all day, and so you can bother him at your own convenience.
Yes, no, I mean, that's why I'm here. Like, let's network and do something.
Absolutely. Again, I've got a couple of moms who've already reached out and want to help lead the Oregon Families for Vaccines work. I'm mostly leading it not because I'm working with Immunize Oregon, but I'm doing both for the same reason, which is that I'm a mom who has 2 small children herself. And that's why this work is really important to me. I'm going to let you all go for a break now. And when we come back, we will have quite the interesting session with legislators, 2 of which will be joining us virtually. So please bear with me as we get some of this tech working. I will let Jake introduce our panelists, or at least I should say most of our panelists, but as North was talking about, knowing who your elected representatives are, I feel like it's appropriate to say, this is one of mine, Senator Deb Patterson, because I live over in her district. So I'm uniquely with my representatives. Right here.
Thank you, Megan. I'm going to give the senator a chance to get up here. So I'll just introduce myself a little bit. My name is Jake Weigler. I'm on the team with Meg with Immunize, and I'll be leading some conversations later. But I'm really excited to start off today this conversation with some legislative leaders, both from Oregon and around the country. And before I just launch this, I'll say back in my former life, I was going to be a political science professor. And one of the things I just would say as we go through the conversation today is there's something called a coordination game. Everyone's probably heard of Prisoner's Dilemma. That's very famous. But slightly less famous is what's called a coordination game. The example they always taught me was, let's say you and your friend or significant other are trying to decide where you want to go on holiday. You might want to go to the beach. They might want to go to the mountains. You know, at the end of the day, you might want to go to the beach more than the mountains. And they might want to do the opposite. But it's really important that you end up going to the same place. Because if you end up going to holiday, one person's at the beach, one person's in the mountains, it's probably not going to be very fun. So I think that's really relevant today because it takes two to tango when you're talking about legislative solutions. It's great that we have a really engaged, active space. Really appreciate North's thoughts on that presentation. But at the end of the day, legislators also have to be there to play with us because if they're not excited about what we're going to try and work on, probably not going to get done. So that's part of the reason we wanted to have this presentation today, to hear from some leaders in the healthcare space in the legislature here in Oregon, as well as folks who've done some really important work around the country. And so wanted to use that to become a move into a conversation about policy. So let me introduce our presenters today, our panelists. The first is State Senator Deb Patterson. Representative Deborah Patterson is an ordained clergywoman in the United Church of Christ. She recently served in a historic rural congregational church in the Midland Valley. Prior to her return to active ministry, she was the executive director of the International Parish Nurse Resource Center, which equips RNs to provide healthcare advocacy and education around the world. Deb also serves as the executive director for the Northwest Parish Nurse Ministry based in Portland, and was vice president of the Children's Health Plan. She's also been employed on the senior management team of a multi-hospital health system in the Midwest, and she currently chairs the Oregon Senate's Health Care Committee. And online, we have Representative Travis Nelson. He's the bottom square, one of those squares here. Travis put himself through community college and then Washington State University School of Nursing by working in food service, landscaping, and janitorial positions. Throughout his career as a registered nurse, he saved lives by practicing constant attentiveness, along with being a strong advocate. He specializes in emergency nursing, critical care nursing, medical surgical nursing, and rehabilitation nursing. Serving as a union representative, he's honed his advocacy skills and allowed him to begin tackling many of the problems inherent in our healthcare system. He currently serves as the vice chair of the Oregon House Committee on Behavioral Health and Healthcare. Thank you so much, Representative. And then last, but certainly not least, is Richard Pan, who's a former California state senator. Dr. Richard Pan is a pediatrician, former UC Davis educator, and former state senator serving in Sacramento and surrounding areas. Dr. Pan graduated with a Bachelor of Arts in Biophysics in 1987 from Johns Hopkins, before earning his MD at University of Pittsburgh in 1991, and a Master's in Public Health degree from Harvard University School of Public Health in 1998. Dr. Pan moved to Sacramento to accept a faculty position at University of California, Davis, where he wanted to direct the school's pediatric residency program. And of course, for what we're talking about today, Dr. Pan was the lead in the work in California to eliminate non-medical exemptions. So our neighbor in the South maybe has provided some great insights on how we can explore similar conversations up here. So thank you, Dr. Pan, for joining us. So the goal today is really to get a conversation going. And so really we'll welcome folks to both online and here in the room to ask questions to them and learn both about kind of their perspectives and insights about the immunization conversation as well as the legislative process. But before we jump in, I want to just give each of our panelists a little bit of a chance to kind of offer any initial thoughts that they might have, and really would welcome anything that they would like to contribute. So, Senator, do you want to start us off?
Sure. Now, just to be clear, just initial thoughts, or would you like me to share the thoughts that I brought?
You should bring all the thoughts.
Okay, well, that won't take too long. Okay. And North, I'm sorry that I didn't hear your whole presentation, but I loved what I heard at the end. And kudos to you. Dr. Pan, I'm anxious to hear about your work in eliminating non-medical exemptions. And so thank you for joining us virtually in beautiful downtown Salem, Oregon. And you're almost to my Senate district. It ends on the other side of the street. Representative Nelson, nice to see you again today. We were together at the Oregon Nursing Association lunch this Friday. Representative Nelson is doing amazing things. And Dale, nice to see you again today. See Dale almost every day. He is out and about. So my background, as you heard, is clergy. In a church serving, my phone would ring all the time. With the hospitals calling and saying people's insurance, they're like what they used to say. Instead of saying their insurance right out, they'd say their length of stay has ended. Can you help them get care at home? And so finally I decided I was really tired of not helping them, but tired of hearing this story. I went back to school, studied health administration, and found this group of nurses who shared that, because nurses, you rock, right, Travis? Yeah.
We do.
And so these are registered nurses, seasoned, we call them, basically old. And they would want to try to do prevention rather than clean up an L3 in the emergency department. And so vaccinations were extremely important to them. They would arrange for flu shot clinics, and because of their school practice, they couldn't themselves get it, but they would have people come. And so what the thought was, couldn't we just define our neighborhood of the old-fashioned word for parish, your whole neighborhood, and go out and make sure every kid in that geographical area was vaccinated? It's a great idea. It's hard to do. Just why you're having this conference. How do you get everybody vaccinated? But I was really thrilled that in 2023, then Governor Brown asked, who had just finished up her term, had asked us to bring a bill, House Bill 2278, which would allow pharmacists, yay pharmacists, right, to give vaccines to kids who are 6 months and older. I was worried that doctors would not like this, but the pediatricians said yay and go for it, and so it did pass, mostly on a party line, and I don't know why that should be a partisan issue. Why having pharmacists give vaccines to whatever children should get. But anyway, and I'm just really excited. I want to hear from the others about things that are, by the way, that's effective in 2 days. September 24, 2023, pharmacists will be to give vaccines to infants and toddlers. We have a short session coming up in Oregon, so there's not much we're going to be able to do. We each get priority bills, and each committee, our Senate Health Care Committee, only gets 30 bills to cover behavioral health, pharmaceuticals, health insurance, access to health care, disability and health care. So as you can see, there's not much, but we can do other things, such as having this governor perhaps declare August as National Immunization Awareness Month, set up free vaccine clinics like they do in Tennessee, where they vaccinate 10,000 kids on Fight Flu Tennessee Day. And I'm very, North, I noticed on your resume that you have also worked and galvanized a lot of that to work for eliminating non-medical exemptions. So I have to say, and I'm going to end here, is that I get more emails about, oh, hi, how are you, Sarah? Good to see you. More and fair that I do get more emails from people saying, don't force us to vaccinate our kids. Only since the pandemic, only matched by people saying, don't force us to wear a mask, right? And I think really so many emails, and I'm sure other legislators do too. So thank you for your work. Your voices are so important so that we hear something other than those, because we don't get emails from people saying, thank you for having us make sure we vaccinate our kids before they go to school, right? We get very few of those. So your voices and the voices of your colleagues, constituents, stakeholders are critical. So I'm going to end there. Thank you, and I'll talk to you later on this question, but anxious to hear from the others.
Absolutely, thank you. And I can't say that I'm surprised you don't get a ton of thank you emails, but it's a good reminder to us of what we have done here. So let's go to our next presenter. Representative Nelson, do you want to go a little bit? And, again, would love to hear your thoughts, both kind of on the landscape and if you have any kind of particular parts of the conversation you want us to raise up, because, as we transition out of this panel, we'll start talking about looking forward to that 2025 session and what might be possible to bring to the legislature. And so if you have breadcrumbs or points of encouragement you want to make, we always welcome suggestions. So thank you for joining us.
Thank you. Yeah, I will. I'll be brief so we can dive in a little bit more. But State Representative Travis Nelson here. I've been a registered nurse for nearly 20 years. I'm a former vice president of the Oregon Nurses Association and have worked in a variety of settings. Currently, I'm working per diem in employee health, where I give a lot of vaccinations. But I'm very concerned with where we are politically right now when it comes to vaccinations. It's become such a divisive and partisan issue when it really shouldn't be. And we've got to figure out a way to break down those barriers, because diseases like whooping cough and measles should not be diseases that we are dealing with today. And yet we're starting to see a resurgence because people have lost trust, not just in vaccines, but in government. And so we've got to figure out how we restore that so that we can maintain a healthy society and healthy communities. It just amazes me. Everything that I hear when it comes to vaccines from people in the community, from people and constituents. I think it's probably more of a right issue, but there are definitely progressive people and people who, are Democrats who don't believe in vaccines either, or believe that vaccines cause autism. So I'm committed to doing the work to ensure that we've got healthy communities, and let's have a conversation about immunizations. Thank you.
Thank you. Yeah, then when someone figures out how to depoliticize this, let us know. Somebody to jump in. Well, thanks. That's wonderful to have you here. I'm really excited to have you as a partner in the work. Let's now turn to Senator Yen, who is taking some time off the campaign trail as we move on to the next opportunity. So really appreciate him making the time just to share with us about kind of the experience in California, any lessons learned or wise words of wisdom that we might want to take as we're doing work here in Oregon. Thank you, Dr. Yen.
Hi, yes. So it's a pleasure being here with all of you. I am trying to escape the noise here, but it keeps following me here. So I apologize for the background noise. I'm actually in DC at the National Vaccine Law Conference. So greetings from the other end of the country. I'm sorry I couldn't join you directly from California, but it's a thrill to be here with all of you. I want to share maybe a few lessons or thoughts in terms of preparing for any sort of vaccination legislation. Admittedly, it is a very challenging time, and I think, as Representative Nelson mentioned, unfortunately, public health has gotten highly politicized. Now, actually, let me reframe that. Public health is always political because after all, it's about affecting the population. but it's certainly gotten a lot more partisan, right? So it's always political, but it's gotten a lot more partisan. And in many ways, we're doing the challenge of, in fact, as people are coming out of the pandemic, although I would argue that the pandemic definitely still here with us in terms of we're seeing the resurgence of COVID, that the lessons people have drawn from that, unfortunately, are not the ones that most of us in public health and medicine would think people should have drawn from that. And there's a lot of disinformation, misinformation, and that tends to be the case anytime we talk about vaccines. This goes back, to the first vaccine that Jenner did. But when it comes to trying to move legislation on vaccine, one of the things that I learned and that I think is very important is be sure we put parents as the face of the effort. Right. I'm a pediatrician. It's great to have doctors and public health and scientists saying that we should do this, but we should put parents as the face of the effort. And you don't want to be in a position where you tell a parent who says, my child is vaccine injured, they have autism, and saying, well, you're wrong, right? You need to have parents talk about why it's so important for people to get vaccinated. I would particularly be trying to figure out how to recruit parents who have children who, for example, may be immunocompromised and therefore either can't get vaccinated or basically would not respond fully to a vaccine, and have them talk about how important it is for their child to still be able to attend school, right? Their child's right to an education. That's so very important because it can't just be about people who refuse to vaccinate their children. That's a choice. You have parents whose children do not have a choice, but should certainly deserve to be able to go to school, to have that education, to be with their classmates, and that their rights should not be trumped by the choices of others. And I think that's going to be very important. So you need to find people, you need to find families who'd be willing to speak out. Unfortunately, for full transparency, you also have to explain to them that their advocacy may cause them to be targets of harassment and threats, because unfortunately that is the environment. And certainly I can understand families not wanting to do that, but that is unfortunately part of the challenge. We need to find a way to support those families in a way that that they're protected and they feel they're safe, and also that they have support for that. And unfortunately, that is part of vaccine advocacy. But it is very important to have parents at the face and to really talk about the fact that so the opposition will say, I'm in support of medical freedom. We need to talk about, we're in support of disease freedom. I want the freedom to be free of disease, right? The language of rights and freedoms and liberties are ours. It should not be theirs. Okay. Every child has a right to go to school safe. Right. And if you make a choice to endanger someone else's child, then that's the reason you're being excluded. It's not because, we're discriminating against you or anything like that every child has a right to be in school safe. And so that's the central messaging that needs to go across, that we need to talk about the liberty, the family should have the liberty to not have to worry about the child being, infected with a potentially dangerous disease, right? And that's the purpose of any sort of, of legislation or other rules to require vaccinations for schools. Schools should be safe places. And that's hopefully a message. Now, the other thing is, of course, again, we want to try to build up organize the group of parents to advocate for that. That's going to be really important. I would say that we got to organize the pro-science parents, right? And in particularly parents who can tell the story about what's happening for their children, why are they advocating for this? Because they want to be sure the schools are safe, not only for their own children, but for all other children. And so I would just recommend that's, to think about the framing of the message and being sure that we do not basically allow the opposition to define what the debate is about. You need to define what debate. In fact, it's tempting to try to go and counter all the myths and lies that they have. Well, it's important to do that. Don't make that your leading argument, okay? Start off with your message first. Don't get sucked into trying to counter their message all the time, because they'll just throw everything against the wall. So always start off with your message and be sure you end with your message, right? be sure your message is the first message you talk about and the last message you talk about. And if in between you need to counter some stuff, that's good. Okay, but don't lose sight of the ball. Right, and so those would be, I think, my top level recommendations if you are working toward trying to keep, again, all children safe in the state of Oregon.
Wow, that was great. There's so much there to unpack. And, I think if I could try and distill, I think, I heard three big things there. One is that our elected officials are not robots, that they need to have some emotional connection to our side of the equation. So those parents and other impacted folks, children, I think that really helps tell a narrative to folks and make them have some compassion and compel them towards action, not just an analytical approach of numbers and statistics and data. We really need to have that piece that connects with people's heart as well as their heads. I think that's a really important point that sometimes gets lost on our side because we know the science and the data is on our side, so we feel like that should win the day, but unfortunately it's not enough. I really like the second piece around framing and that we get trapped in this narrative of that it's asking people to lose their freedom for the collective good. And then it gets into a very tough dynamic of saying, well, how much individual liberties should someone give up for this broader goal versus saying, no, actually, everyone has that right to freedom, liberty to enjoy society, even if you're immunocompromised or there's other reasons why. There are specific reasons why it's important to have community immunity for people to exercise their rights and freedoms. And then I think the third piece, and I'll say this is one of the hardest things to learn when we've been starting to do advocacy work here in Oregon, is coming across people that were really brave, stood up in 2015, 2019, took a stand and talk about how difficult that was in their life, how they have suffered repercussions, how they were harassed, targeted, and things like that. And they aren't willing to come back to the table for engage in this work. And so I think that really underscores the importance of building this movement, but there's a broad-based support. Unfortunately, we have a politics right now that sometimes operates based on intimidation. And the way you do that is by picking out a few people and making an example out of them. And so by having a broad number of people stand together, it makes it so much harder to decide to do that. So I really love those comments. But now I want to stop talking, hear from you all. So I'd love to get comments from folks in the room here or online. I'm going to do a better job. I know sometimes online people have been having trouble following this dialogue. So I'm going to try and do a really good job repeating questions they come up. But I want to throw it over to this room. Absolutely, Senator.
Thank you so much. I really appreciated both of your comments, Dr. Kennedy. I'm sorry, Dr. Beck. I was going to say that right, so my apologies, Representative Nelson. My question is a comment that Dale and I both are Rotarians, and polio has been almost eliminated in the world, and Rotary is a nonpartisan organization. What is the success there that organizations have over many years to get almost the entire world vaccinated against polio? What do you recommend that? And then the other thing is South Dakota, which is a rather conservative state. In-laws all live there, so don't tell me I said that. But they have the highest immunization rate in the country, 55%. So again, what are the secrets in those places? And I would access, but I just think it's important.
Absolutely. I love that polio example. When we were doing some work early, we were trying to kind of find stories that cut against the grain. And it was fascinating to learn that when they first rolled out the polio vaccine, there was actually a batch that went bad. And a lot of people got pretty sick as a result. And you can imagine if that happened in this moment, the political backlash that would occur to that vaccine. But President Eisenhower, to his credit, at that moment said, you know what? This is such a debilitating disease for so much for society. It's horrible this happened. We feel really bad, but we have to push forward with the program. And obviously, we've seen the best of stuff today that, I don't have little heart. I don't want it was eradicated. Well, my generation younger don't have to never deal with it. I was but I will say then, I know Mitch McConnell's in the news a lot lately for various reasons, but I will always give him credit that as his party has moved away from supporting the science and the data behind immunizations. He's been pretty stalwart on that. And of course, the obvious reason is that he himself experienced polio as a child and was actually lost to life for a number of years. So I think from him, it's a very personal reality that this is an important step for our society to take. Importantly, because it's been so successful, a lot of younger people today don't have that appreciation of how destructive it's hopefully we're gonna wrap it. So let's get back to the group conversation here. Dale.
Thank you very much. My name is Dale Penn. I'm a lobbyist. I represent a wide range of clients here in Oregon, several of them in the healthcare and public health space. I would probably say lead on vaccine legislation in 2019. And Dr. Pan, we followed your work both in 2015 and 2019. I really appreciate everything you've done in California to act as kind of a bellwether for a lot of other states. Love to see more movement here in the state and elsewhere on this issue. We were very close to passing legislation that would have, I believe, increased vaccination rates for kids in Oregon, addressing some of the exemption issues similar to what you've done in California. The question I have for you, Dr. Pan, is after you successfully passed legislation in that arena, one of the arguments, or several of the arguments we kept on hearing, was that you pass this and people are going to leave the state, people are going to take their kids out of school, it's going to be a doomsday scenario. You've had several years in California of passing some of these legislative packages on vaccines. What is your personal and professional opinion of the impacts in the state, and how can we utilize some of that in our own messaging here in Oregon?
There are many claims made by the opposition which are not grounded in any realistic facts about the impact of this. So first of all, I'd make note that the impact of the legislation in 2015 was that our vaccination rate overall for children entering kindergarten exceeded 95%, which is the threshold for community immunity for measles. Probably more importantly is that the number of schools that had particularly low vaccination rates actually decreased, right? So those are basically the hot spots, right, where you're going to potentially have an outbreak where you have vaccination rates that are really low. Of course, the medical exemption rate rose, which is why in 2019 I authored SB 276 to give oversight. But that was actually in some senses, I would say, partially intentional. In other words, I try not to bite off too much at one time, right? So, I mean, someone could have argued, well, when you did 277, why didn't you just fix the medical exemption while you're at it? In fact, some people criticize me for doing that. I'm like, well, the problem is that you try to do too much at one time, you're not going to get it all through, right? So the first thing was, let's focus on addressing. And then what happened is that if there's proof that they will raise the medical exemption, not surprisingly, but because until we eliminated the non-medical exemption, we didn't know what was going to happen to the medical exemption for sure. So let them prove that they're now a problem, and then come back. And the other thing I'd also make note is I've only authored legislation when there's been an outbreak. I even tell the opposition, I said, well, if outbreaks stop, I will stop introducing legislation. But guess what? When immunization rates fall and you're successful, outbreaks go up. And then when outbreak happens, yes, I will author, then you got to do legislation to protect people. And so that's what happened in 2019. We had outbreaks of measles in different parts of the country. Interestingly enough, when you talk about outcomes, even though SB 277 wasn't fully implemented, the way we did this, and part of it was to actually eliminate any cost associated with the bill, was that we phased it in over several years, right? But still, our immunization rates were high enough that even with measles going across the country and showing up in California, we never had an outbreak as large as what happened in 2015. Now, in terms of school kids leaving the state, after passage of SB 277, there was no sign of school kids leaving the state. The projections for school enrollment pretty much were consistent with what we expected. Now with COVID, there's been a drop in school enrollment, but I think that's related to COVID. Someone could claim it had something to do with the bill all back in 2015, so that makes it a little hard. But basically, fundamentally, there was no large exodus of children from school districts after passage of SB 277. So that was a claim that was made and did not bear out. In fact, actually, now this is again anecdotal, so I know we're data people, so sorry, this is an anecdote. But what I've heard, well, actually, let's put it this way. The data shows, there was a study done that pediatricians had to spend an average of 20 minutes per child to talk to parents about getting vaccinated. In fact, vast majority of the time they're successful. But spending 20 minutes of a visit to debunk anti-vaccine myths, right? To convince the families of it, on average 20 minutes. Think about it, that's like almost an entire visit by itself. After passage of the bill, anecdotally, I was told by my pediatric colleagues, oh, by the way, that simply dropped to like a few minutes. So as soon as the kid shows up and they say, I'm not sure about vaccine, well, let me answer any questions you have. And by the way, it's required for school. Oh, okay, I'm getting my kids vaccinated right now. So, so there is some anecdotal data from my colleagues, from several colleagues in the pediatric world, that actually they now have more time to talk about other things other than vaccinations at their well child check visits. And hopefully that's also public benefit as well.
Great, thank you. Other questions? Yes.
Step away in a few minutes, but I just wanted to ask, there's a lot of what I would characterize as lying, cheating, and stealing politics. And I mean that very specifically, like lying about things like the climate or vaccines. Stealing in terms of disenfranchising people, gerrymandering districts, and eliminating the right to vote, and bullying people to their and I don't advocate either of those, but the cheating, I actually wonder about that could be something that we might want to do more. And by cheating, I mean things like having a walkout every single year so that you don't get to vote on things, even though the Democratic Party holds a majority in the state. And somehow Republicans are really good at all three of those things, and they cheat constantly to make the system work for them. Or, for example, getting federal judges and Supreme Court justices to support their agenda. And I wonder if there might be an appetite for some cheating and breaking the arbitrary rules that we have that are playing against us and actually trying to set up a system that is more fair by ignoring some of the rules that don't actually serve us purpose.
I will let Deb go first, since her chamber has been the problem.
Your representative down. Yeah, you know, that circles back to the South Dakota question, which is overwhelmingly with the highest rates of compensation. I'd like to know more about that. Are there ways that we can work together better to try to find a path forward so that we don't have lockouts? Because that doesn't help anybody, does it? Yeah, I would have loved to see higher fines earlier on. I mean, you take an oath of office, you say you're going to show up and do your job, like the people that you should do everything you should do immediately, 10 days later or whenever they're sent or whatever. We need to work together. And you know, surprisingly enough, 95% of the votes that we passed last year here did have support. We did have some Republicans who voted for the vaccination bill this last session. So just circle back to the Rotary question. How can we find ways to adopt? Dr. Pan talked about this brilliantly, changing the narrative and the way we tell that story so that it's freedom from disease. We all want a little freedom now, don't we? And we do want freedom from disease. We want freedom from launch, freedom from hunger. We need to circle back to those days of during the Great Depression, the freedoms for Americans, and I would say all people, not just the ones that can provide citizenship. So, your turn, Representative Nelson.
Well, thank you, Senator Patterson. I'm going to be a little more direct. We need to get rid of the current quorum requirement and go to a simple majority. I don't know when that's going to happen, but I know that there's a lot of conversation around that. And it's what the vast majority of states in our country do. If the people have voted and selected their representatives to both houses of the state legislature and the governor, the people who are the majority in the state house should be giving direction when it comes to policy and leading. And so this ability that we have in our state for the minority to walk out and grind business to a halt has got to end. I know we all voted, what's that been now, in 2020 to limit the ability of representatives and senators to run for re-election should they have excessive absences. And we saw this past session that did not stop folks who wanted to see business come to a halt. So bottom line, we got to change the quorum requirement in Oregon. It's much too high of a threshold.
Well, I'll just add, because I'm not in the legislature. When you talk about cheating, I think that could be as simple as knowing the rules and knowing how to use them to your advantage. You gave that great example of Louisiana, where, they were able to just stall out the clock and beat a bad bill by delaying it through the deadlines. Unfortunately, that's the advantage to being on the no side of a bill. It's really easy to just find a weak point in the process and knock it down your tail, because done quite well figuring out those on different legislation. Where when you're trying to get on the yes side and pass, of course, every step in the process, you have to make sure it goes right. I think that's the challenge we've had here is, we've done a great job of stopping bad bills now. But now we have to figure out how to affirmatively work the system and pass good bills. And I'll just add, I think elections are a really interesting conversation to have. I remember I used to work on gun violence in the public health space, and I kept saying to some people when I was a little more idealistic and believe in things, that, I was like, well, this is an 80-20 issue. 80% of the public's in support of it. Why can't we get this bill passed? And someone said, you need to understand that 20%, that is the core of who represents the primary voters for a lot of these Republican elected officials. So for them, this is not a calculus of, well, where does the public come down? It's a question of, will I survive my next primary election? And so you can look at ways to maybe restructure those elections or restructure districts, change those dynamics. We're probably not going to get that done in the next week, though. So I would encourage us to keep thinking about what we can do within the rules and to take full advantage of every opportunity margins there to do what we can. Absolutely.
Oh, I would just like to add and thank Dr. Mann and Representative Nelson for becoming elected officials, and best wishes in your campaign right now, Dr. Mann. But I would like to encourage everybody in this room to think about running for office, or to encourage people who, for example, the pharmacist in Hefner has a great representative and they want to consider running for Senate if that seat is open. So I'm not kidding. I think I'm kidding. I was a pastor.
And
that's serious. You need to think about running for office. You're the experts in this field, and you have your colleagues to think about it too.
And I can just add on to that. Oftentimes we talk about how do we persuade the existing elected officials, and we're elected officials, so we'd be nice that we don't have too many challenges. But frankly, sometimes it is about being very strategic on the campaign side about messaging. For example, if someone's in a district where people may be more favorable to vaccines, turn that into a campaign issue that this person is not supportive. I will point out in California, I realize Oregon's different. There was a state senator who was actually fairly anti-vaccine. And we worked, and actually he lost his reelection. We sent a message to all his colleagues in this caucus that he lost his reelection. You're not supposed to lose your reelection for your state legislative seat, especially if we didn't redistrict you when that happened. But he lost his, and one of the campaign issues his opponent ran against him was the fact that he supported anti-vaccine positions. And so we tried to send the message that being anti-vaccine can cost you your seat. By the way, I also point out that Governor Newsom was facing a recall, and we actually got him to win his recall. And one of the important messages was that because he supported public health around COVID and vaccines and so forth. So, and that his opponents actually did not, right? The ones who were trying to replace him in the recall. So, so we did craft a political narrative as well about the fact that, at least in California, and California is a large and diverse state, that being anti-vaccine can cause you to lose your seat and also keep your seat. But you do that strategically, right? You find people who are vulnerable, et cetera. You send the message. You're not going to try to defeat a whole bunch of people, but if there's someone who really sticks out and there's an opportunity, something to think about, right? The other thing I would say is also, I appreciate, we do need more people running for office who are interested, who support public health, et cetera. I know it can be challenging for running for public office as someone who's done it myself. And I know that my two colleagues here on this panel as well, but we need good people to run. And sometimes you don't, and that's important. And frankly, even if you don't win, having those conversations and can be important in terms of spreading messaging. But also, I would just, again, I think you, in reference to the Rotary part, we do. I mean, the hard part is that we do need to figure out, like this, and maybe again, realizing we have limited resources. Think about which districts there's an opportunity to kind of tip the district on the ground in a way, not just in campaign, but also in terms of communications and et cetera, messaging, and then hopefully that will shift the elected official who may actually be voting in a way simply because they're worried about that 20%, right, folks, and that realizing that maybe the other folks would be not so happy. So anyway, yes.
Thank you. I got another question from here, and I think I've got one more over there, but I want to be cognizant of time, especially because of these elected officials joining us.
So I want to echo Dr. Fann's point about power mapping. Looking at very strategically, like we have limited resources, not turning out hundreds of people to the state house. And so looking at those swing votes and figuring out, like, do we need the Rotarians? I've been doing this for 3 years now, and I have not. Everyone says, where are the Rotarians? But no one's saying, I'm talking to the Rotarians. Like, are you talking to the Rotarians? We need people that are going to do that initial outreach and figure out why they aren't with us, and then begin to map it. So I think it's being strategic with our resources and our time to figure out who we need with us and making sure that we're bringing in diverse voices and figuring out how to move those lawmakers is the only way that we can be successful, particularly in a yes vote, whereas a no vote, it always often just stop it.
Hi, everyone. Sarah Lochner, Executive Director of the Oregon Coalition of Health Officials, representing Oregon's public health departments across the state. That's my day job. In my personal time, I started the Public Health PAC to help elect good representatives and senators like Senator Patterson and Representative Nelson. And I would be remiss in this conversation if I didn't advertise the fact that if you don't want to run for office, you can still help support pro-public health and pro-immunization candidates by donating to the publichealthpac.com. I'm also looking for board members to help me raise money and help direct those funds. So please email me through the website, and I would love your assistance. Thank you.
Awesome. What was that website again?
The publichealthpac.com.
The publichealthpac.com. We all got that at home. We have another question right there.
Okay. We have time for one more question, but I want to make sure not to keep our electeds too long.
As long as you guys are in the room. My name is Amanda Patrick. I'm at the Center for Health Research at Kaiser Northwest. And while I work at Kaiser, I'm almost 100% funded by the National Cancer Institute.
And so I obviously have a very distinct interest in HPV vaccination uptake. And we know that the data is showing that we're going to see an uptake in HPV-related vaccines in rural, or in HPV-related cancers in rural areas in the upcoming decades. And that's a very particular legislative body that we need to address. What are the best communication channels between people like us in this room and legislators like you? How can we not only get an audience, but also continue conversations as we're learning and as the science develops?
Well, I think everybody runs their office a little differently, but in my case, just email me and say, I'd like to meet with you, and that's on the calendar. So I'm going to seriously, most in Oregon, given the fact that we work a different schedule, except for those people who work full-time jobs elsewhere, makes it much difficult. I think people do want to be responsive.
What about the Republican senators as well?
I'm going to turn now to Representative Nelson.
I didn't hear I had a hard time hearing the question, the follow-up.
The question was working on HPV issues that we're going to likely see an increase in HPV-related cancers in rural communities. And those are largely represented by Republicans. So how do we figure out how to better engage those legislators and help them be partners in the solution?
Yeah, I think it's key to bring, not only to reach out to them and get meetings, but when you do that, bring constituents, bring people from their community, bring business owners, bring people who work in healthcare in their district, bring people who are in their party. If you're able to, get, whether they be Democrat or Republican, folks who are registered within their party to speak to them on the issue. I think that's the best way to go about convincing them and getting them to move is by having people from where they're from who are aligned with the argument that you're trying to make.
So what I would add is I fully agree with what was said. When you're meeting with a legislator, you want to bring one or more constituents. We can get a cervical cancer patient or survivor, head and neck cancer patient or survivor to talk about their story. That's going to be really important. Now, one of the things I also want to point out, though, is that you can convince the legislator, but it depends where their district is, right? Now, all of us as elected officials, we can be a little ahead or behind our district, but we can't be too far away from our district, right? So I will tell you that when I had to talk to some of my colleagues about vaccinations, several of them agreed with me and said, no, you're right, Dr. Pan, and actually, I trust you, you're a physician, et cetera, but my district, I'm not going to win my primary, and et cetera. And so we got to do both, right? So yes, meet with the legislator and so forth. But the problem is if there's an active anti-vaccine movement going on in their district, you got to help them counter that. You can't expect them to counter that on their own by themselves. So you need to be thinking about both. If you got the legislator thinking your way, their staff, et cetera, you then also got to say, how can I help you? Or how can we try to start convincing people in the district, right? Start turning some of that, which by the way is a lot of work. So I'm not, hold showings of a movie like Someone I Love, right? I think that's about HPV vaccine, cervical cancer, et cetera. Things like that. Try to meet with not just Rotary, PTAs, et cetera, right? And have people talk about. Especially if they're in that community, talk about, okay, I got cervical cancer and this is what happened. And I had, so I don't want that to happen to you. Right. And that's why, so in a very non-political way, right. I mean, that's back to how does the Rotary, right. To have those non-political conversations about to try to help move the needle. Right. And so I think that's part of it. Again, that's trying to be really strategic about There's some legislators that may come from district where it's a matter of convincing the legislator. There'd be other legislators where maybe the district, you can move the needle a bit and you can move both of them together. There might be an opportunity as well. And then it's a matter of just getting, well, sorry, I know you with your quorum requirements, it's not quite the 50+1. So
And Jake, can I add one more thing?
Everyone wants to talk, so yes.
Oh, go ahead, Senator Patterson.
I was just going to say, also reach out to the vice chairs of the health committees in the Senate and House. They are the other party, and in my experience, the speaker and the president always try to make someone very reasonable to that, so you probably will get some traction with the vice chairs. And then I'd also recommend that you reach out to the county commissioners, as here in Oregon, as you know, the Board of Health essentially are the commissioners. And so if you can find an ally on the commissioners to go with you to talk with the legislators, we have to say.
Thank you, Representative. Go ahead.
Yeah, I know. Like Senator Patterson said, different elected officials run their offices differently, and it can be difficult to get a hold of some people. I may regret saying this, but I know personally, sometimes people will DM me through social media, and if I don't respond to everybody who does that or tags me in something, but if I do some digging and see that they're a constituent, and I will oftentimes pick up the phone and give them a call after verifying that they live in district.
Slide in there 2 minutes. I love it. And one of the things, and I know we're out of time, so I'm just going to add this wrap up. I always try to think about connecting an issue to something they already care about. So, for instance, with cancer, I might say, there are inequities in the health system. It's harder for your constituents to access treatment, to care. Particularly, it requires access to specialists and stuff like that. So all of this is care or preventative care that will allow your constituents to have better health, because they may already be focused on kind of that inequities issues. Having another discussion, and you can pull back and think of a lot of different ways to kind of reframe conversations about things that you already care about. But anyway, I just want to take a minute to thank all of our participants today. Thank you so much for making the time. Really appreciate that. Next time we'll be coming to you with our list of demands, so be prepared. But don't worry, that's not going to be for a while. So I just wanted to, again, I really appreciate the conversation today. Look forward to continuing the conversation. And if there's anything else you want to pass along to us, we're always welcome input and collaboration. So thank you so much. I think we are going to be ready on this.
I think we'll take a quick break, maybe a few minutes so people can stretch their legs, and then we'll move into our work session. I am going to ask that if you're staying, please take the work session, but I don't know, Jake, I think it's going to be a little bit more interactive. So I will ask one more time for people to move kind of closer together and do some of that work. So thank you again for our virtual speakers. Thank you again, Senator Patterson, for joining us. And we'll see you in a few minutes here. I think probably around 2:05.
I really appreciate everyone hanging in. I think we've had some really good conversations, but this is a part of the day where we're going to really start to roll up our sleeves and do some work together. And so excited to see where this conversation goes, and also say I think this is just the start of a conversation. For folks who maybe aren't as familiar with the legislature, if we're looking at 2025, which I think we've all agreed we are, vaccine legislation is not something you try to get done in a 45-day session. We have a lot of time to work forward on this. And so our goal today is to start thinking based on the conversations we've heard and the different perspectives and backgrounds that folks have around the table about different ideas that we could look forward to bring to the legislature in 2025. And I'll say, I think right now we're really trying to get a grounding in policy. And so I've taken a lot of notes over the previous few hours of some different ideas that I think may be worth exploring further. I would really welcome anybody else online or in the room who wants to add to this list. And our goal today is really that brainstorming opportunity to think about a lot of different areas we could go. And then over the next 9 months, 6 to 9 months, really try to dig in and think a little bit more about where we can prioritize, and then also what we think is an achievable agenda in the legislature. Because, to my comments earlier, I think we've actually had some really impressive work on vaccinations in the legislature. Unfortunately, we just have not been able to get one of those bills over the finish line. And so to take all the enthusiasm and work we have here across the state and keep that and sustain that and grow that, we need to be able to translate that into something we achieved in the legislative process. We actually had some good successes, as you heard, this year by being pretty modest. And so our goal is to think about kind of what are the most impactful and important things we could talk about and work on the legislature, and then also have confidence that we can show results to the larger movement and get them continue to engage in the work. So to that end, have outlined some general categories here to help clarify our thinking a little bit. And you'll see these kind of align with the areas that you'll see in the committees that we've set up, the Advocacy Committee. A lot of folks are probably familiar. We have our Access Committee, thinking about how we can increase access to vaccinations. So less around trying to navigate vaccine hesitancy, but simply if someone wants to get a shot in the arm or a mist in their nose or however that's delivered, how do you make it easy for them to do that? And that should be included both kind of overall general strategies and then some community-specific strategies. I think we all kind of learned during COVID the importance of thinking intentionally about different populations and where there are lower uses of immunization and how do you go meet that community and engage them where they are. So really want to think about those areas. Second is the misinformation. You heard, as North put it very well, beyond kind of the anti-vaccination movement, we've heard about this a lot, there's just a lot of people that have questions and they get misinformation and they're exposed to it through a variety of means. How do we support, whether it's health providers or the general public or whatever that vehicle might be, how do we navigate that dynamic that is preventing both children and adults from getting vaccinated and creating community immunity? And then this highly precise other category known as other/cash. And I will say I kind of lump those together. I think there's a lot of other policy initiatives that I've heard about. And I put cash over there because I just think for folks who are familiar with the legislative process, anytime you're going with a financial or budgetary request, it looks a little different. You have to go through the Ways and Means Committee. You're competing against all the other fantastic things that are trying to get funded that session. So it's a different dynamic than this is a good policy, you should adopt it. And so wanted to break those off because I think as we look forward and try and pick out which of these things we want to prioritize, knowing that if you're going to go for a financial ask, that's going to require some intentionality. So before I just start throwing things up on the board, I want to throw it open to the group. Do people have any ideas that they would like to suggest? And again, I've just been trying to capture ideas that I've heard from the day. I thought we might walk in today with like a long list and I'd have to be like, all right, let's start crossing things off. But we're at the other end of the spectrum, which is, what do people want to put on the list to think about? Okay, I'll kick it off. Yeah, great.
So I mean, so again, Dale, and I'm a lobbyist and represent a whole wide range of entities. While I would love to say let's put something up there, progressive and expansive. I think we all know that that's not really in the cards politically. I like the idea of trying to come up with, and this is kind of a multi-pronged approach of an increased education and awareness campaign on vaccines. What does that look like? How do we work with the local public health, which is already doing quite a bit, with OHA, with schools, with pediatricians' offices? You know, how do we expand the amount of money that those entities have to do more vaccine education and awareness? And can we work collaboratively to come up with maybe some additional generalized branding or a campaign of some kind that everyone can utilize? I mean, a lot of this is already being done. And part of maybe the first conversation is to look at what all of those entities are doing and what can we share, and what would an influx of a few $1 million, $10 million do to try to combat, all with the goal of getting people more comfortable in Oregon with vaccines in general, and then having a conversation maybe about exemptions or something else, some of the more difficult conversations a couple years down the road.
Gotcha. Absolutely. So let's put that under misinformation, I think, even though it goes well beyond that. So that'd be a public education campaign. And maybe we put like a $ parentheses next to it, because it is probably going to not happen for free. And I think there's a few points that I actually fit very well under that I had kind of captured earlier. You know, one is, it was really interesting during the provider panel to hear about kind of this distrust in institutions. And so that it wasn't even like a factual conversation of trying to like debunk or unpack something they had heard. It's just, you know, I don't trust any of this conversation. And so I think that's one piece that's probably worth highlighting, is how do you navigate that? I think you also heard in that panel around the question of information silos and kind of where do people get their information, and whether we want to engage in trying to kind of unpack that and think about, oh, well, you get all your information from Joe Rogan. If that's where you're going, then we'll have to engage you this way. So I think that's also came up. Another piece that I put under that was this idea of kind of disease pathology. I don't know if folks have heard this. OHA, I believe it's OHA, has been running a pretty interesting public education program. I hear it a lot on the radio and on my Pandora, encouraging wellness visits to pediatricians right now, saying, you know, you may have delayed it. And it's really interesting to me because it talks about kind of overall wellness of the child, and then they touch on immunization with never saying the word immunization. And they say, well, it gave us a chance to protect my kid against meningitis and a list of a few other diseases. So rather than focusing on, are you getting your shots? It's like, you want to be protected against these diseases. And so I think that's an interesting question. If you maybe help people understand how bad the measles really are, would that be helpful to folks in kind of helping them be more accepting of, yeah, I don't want my kid to get that. Let's do what we can. So I think those are a few things that I captured here. Anything else people would want to kind of put under that bigger bucket around a kind of public education program? Yes.
Yeah. That I was going to say that.
Yeah.
Just that to normalize vaccines and just doing a campaign around that. I know Idaho was trying to do something around that. They've done a broad media campaign to try to normalize vaccinations because they have such a huge anti-vaccine population there. And then the other part of it is just educating legislators as well, especially new legislators as they're coming in, that may not be adept on all, vaccine issues, but just having, either, a parent advocacy group or, the coalition come in and do some education with new policymakers, just to make them aware of some of the vaccine issues, the high exemption rates, the disease incidents, and all of that.
Absolutely, yeah. I mean, if they don't have the basic information, how could they be ready to make decisions on this? So let's put that in there. Anything else to put into this kind of public education program? Okay, and we can come back to these again. Like today is start of 6 to 9 months of policy development, so not the last bite at the apple. Another piece that I was interested to hear about and maybe the answer is no, there's nothing to do there, was this idea around direct delivery from counties. I thought that was really interesting that we're seeing counties go away from that, and it sounds like that would have to be a very county by county specific understanding to understand what decisions are driving that, whether it's ideology or resources, or they already feel like there's partners in the community that fill those gaps. But to me, that was interesting to hear that that's an important kind of safety net or way to ensure kind of broader. So I was interested if there might be an opportunity to engage local health officials. Maybe folks have thoughts on that. But that might be another interesting, that came up during the morning conversation a bit. Yeah, absolutely.
Hi again, everyone. Sarah Lochner with the Coalition of Local Health Officials. So most public health departments still do provide vaccinations. Only really one has closed up all clinical services and really defers to other community partners. But typically the way they do it is in partnership with community-based organizations or another community entity. When you were talking about taking vaccines to where the people are, that is really, I think, the strategy moving forward, to one, normalize vaccines and to utilize community partners to normalize vaccines and to encourage people, especially in a culturally specific way, from trusted messengers, which I think is the biggest lesson of COVID. But yeah, we're happy, local public health is always happy to partner on increasing access to immunizations for sure.
Yeah.
And then we have some from the online chat.
Yeah. I just want to kind of jump in a little further this, because I know you all joined this afternoon. The topic that came up this morning was the idea that a lot of these clinic and nonprofit partners are centralizing access by saying, there's only one of our sites that we're able to provide vaccinations. And so that's also proving challenging as well. So I don't know if that's
a resource.
And that's a resource issue, yeah. So I think that might be something I'm going to put up here. I don't know what the pen went over there. But that might be something worth exploring. And I agree, it's going to be a county by county conversation and a provider by provider, but clinic plus county delivery. I said I wasn't going to write on this because no one will read my writing, but here I am. Let's go to the online people.
So we did have, we had a comment from Julie Schultz, and this was, I think, during the discussion of a disease-focused messaging. She said, our older pediatricians remark often about how different it would be if kids were routinely coming down with polio and measles. And then Nadeline Begay says, CBOs play a big role in the ground campaigns. I work for a CBO, and we have CHWs at our organization that have great relationships with the community. Bring training to the CHWs and they can disseminate.
I'm going to add that under here.
And then Jamie.
I'm not a policy expert enough in this specific area, but I wonder if there isn't just a need for greater flexibility in the way that the state regulates vaccination administration, and if there isn't a need to like it's not a preemption issue, but maybe there's just a need for definitional change that allows for different kinds of vaccine providers to be able to do that, or different people to provide vaccines rather. And at the same time, I'm wondering if there might be a way to incentivize county level vaccination rates through public health dollars. I don't know if that's I don't know what the thing would be, but looking at the chart that we saw of saying we know where these individual counties are, and if we could incentivize additional public health dollars, additional resources, something like that coming from the state to these counties, it might create those community level specific responses that we're not going to get out of a centralized Salem-based solution.
That's an interesting idea. And I will say, someone told me this, probably someone in this room, so feel free to take credit, that when you're thinking about CCOs, that is one of the key metrics that they're reporting up to Medicaid. It's saying what is utilization rates among the 2-year population. So I've been intrigued to find out if there might be an opportunity for collaboration through the OHP and CCOs, and maybe doing kind of provider area specific policies, because I know, that's going to look very different in Josephine County than in Multnomah County. So, yeah.
I had a question for you, Jamie. So I don't know the answer to this, but I don't know the answer to this regarding access, but we've had a conversation with the legislature the past couple biennium about who can provide a vaccine. So I don't know which provider types are currently out there who now want to be able to do that to broaden scope, but who just don't have access or who haven't pushed that forward yet. But I'd be curious to see what potential low-hanging fruit for additional provider types would be out there. So, I know dentists got it recently, and pharmacists.
Yeah.
Quick comment on that. Kevin Smith, pharmacist. I think one of the things that we struggle to think about in rooms like this is the operational support and the infrastructure that goes into the back end to operationalize. I'm going to use the example of expanded providers being able to give immunizations. There's thousands of dollars in setup costs, making sure that you have the right refrigerators, have the right monitoring, get the training in place. That really we all talk about and we think about, let's enable this group, but then we don't allow the infrastructure on the backside to do that. Where do you order the vaccines from? How do you get those contracts in place? There's a lot there. And so in my opinion, I think that if we go down that route, we really need to vertically integrate and make that a simpler process to decrease the barriers to allow for all of the people that can provide vaccines to be able to operationally support and make it more efficient than what it currently is. That's just giving the vaccine. Then we talk about the payment side, right, which is equally as much of a struggle. Getting paid for all of that and the time that it takes to type up those claims, work those rejections, et cetera, et cetera. So there's so many inefficiencies in the system already that I think that we need to be able to support the providers that are doing it, and then be able to look at where are those gaps still, and kind of go from there.
Yeah, so let's go ahead and add 3 to my brilliant other category. I'd say I'm hearing 3 different things there. One is kind of providers eligible to deliver vaccines. One is the operational infrastructure question. And then, of course, this funding question that I think it sounds like there'll be a lot more conversation soon about. But it seems like that question around the state program and kind of sustainability of funding and participation in that program is going to be a big piece. So I'd love to kind of put those 3 there, and then we can see where those go.
I just want to thank you. The infrastructure is deteriorating, and has been for a good 10 years. So that the people who want to give vaccines and the communities who want to support it, there's not an infrastructure to support that. And if y'all have questions about who can and can't and who wants to but is unable to and why, if you ask me questions, I can tell you. Usually I'll have the answer, not always, but I don't want to just sort of start telling you all the things I know. So, yeah.
Well, that's great. And this is, again, these are all breadcrumbs that are going to lead us down past the next few months. So that kind of deep dive is exactly where I think we want to go. And actually, if you come to my breakout, not that Meg's breakout's not awesome, but I'm just saying my breakout is going to be around kind of the...
More people are really tempting his breakout.
No way. No way. Mine is going to be exactly that, of like, how do we go forward and gather the data and the research, because I think that's also something we know. We know some partners are restricted in their advocacy work for a variety of reasons. And so starting with a baseline of knowledge, data, and research was something that I think everyone can collaborate with. And then at some point, it can be handed off to an advocacy conversation. Other things, or we're going to keep going back to my list.
Sorry. And I'm wondering too, with the who the providers that are in network, because I think Oregon's been very progressive in expanding, the scope of practice laws. But then if, say, you can't get an appointment with your pediatrician and you need to get a vaccine, for your kid to get into school, then, can you go to any local health department, any pharmacist or school-based clinic, and could they all be in network or recognized as in network? Just so, that's less of a barrier, because again, if you're trying to process a claim and it gets rejected, but for vaccines, that could be one way to look at, and that could be very complicated. I don't know, but pie in the sky.
Are you reading off my list? Because that's literally the next thing I had written down. I think that's another really important part, and whether you want to call it scope of practice or continuing medical education. It was really interesting to hear about the naturopathy conversation this morning, and that you have a challenge where there's a unique subset of folks that are kind of out there actively marketing for clients and patients, and so they have to kind of lead with something that gets attention, and so that's why they get a lot of attention around kind of vaccine skepticism. I read some, granted not academic, but more lay journalism around Idaho. And for folks who haven't followed it, it sounds like, you have a really low rate of GP to the population, something like 1,300 people for each general practitioner in the state. And so they have really opened up the scope of practice to allow all kinds of specialty to act as your primary care physician, which then people point out leads this weird thing where they're like, well, you're coming to me for this kind of service. And by the way, instead of vaccinating, I have sell this essential oil that you could use instead of getting vaccinated. And so there's been some conversation about whether there could be some opportunities for regulatory enforcement around kind of conduct of care and things like that. These are areas where I rapidly get out of depth, so I'm going to just leave it there. But I think that might be another piece, is kind of looking at professional licensing boards and the existing practices to see if everyone's kind of playing appropriately. Because, we certainly remember that from the legislative session, that the naturopaths were kind of a big question mark in 2019. And it was really interesting to hear today that most naturopaths probably were very comfortable with what was being proposed. It's just a very vocal subset of that practice that ended up dominating the conversation. So that, I think we got it all down, but I think that's a whole other area for us to explore. Other things that we'd want to start thinking about. Yeah.
This goes under the idea that there's no bad ideas in brainstorming, but we allow doctors to reject patients who don't choose vaccinations, to reject. We make it explicit to deny service.
The pediatrician's office who said that they will discharge kids after a certain point. So is that not already allowed?
No, but nobody controls that. So providers do what they do within the scope of their own counsel. And there are some, we have heard of some providers that will discharge patients who refuse all vaccines. I can't tell you how many of them that is. I think it's very small. We have 700 clinics enrolled. We give out $80 million worth of vaccine a year. We know more providers would come on if we could support it. Yeah.
There's legislation in other states to prohibit.
The other way, right? Yeah.
Yeah, so I think.
Yeah, he said there's, sorry for the online people, he said there's legislation in other states that would prohibit doctors from discharging patients for refusing vaccines. So something to watch for maybe. But I know specifically when I had my first baby, I went to a pediatrician's office and it's like written on the wall and in the paperwork that at a certain age, if you've refused this one, I think it's just the MMR vaccine, you would be discharged from that as a patient from that clinic. It was why I chose that pediatrician.
So another one I want to put on the table, and I don't know what this will look like, so we'll see where it goes. I remember we met with some representatives from OHA and got a similar presentation that we got today around data. And part of the information was shared with us is there are some counties that really buck the trend, so to speak. Like for instance, if you look at Klamath versus Lake, you'll see much higher rates of childhood immunization among Klamath. And what I heard in that conversation was that there are some particular pockets of the state that have figured it out, that they have figured out how to build some collaboration among the providers, among public health, to kind of help develop some localized ways to engage parents and kind of overcome vaccine questions and hesitancy. And so that, I think if I'm remembering correctly, Crook, Klamath, and Jefferson, I think were some of the three they're pointing to. Maybe that's wrong. But it's interesting to me that might bear some fruit in terms of, not a new mandate or something like that, but maybe some professional education or other kind of collaborative opportunities to kind of share how you build that structure on a local level and help your patients navigate it. So that, I could see someone saying like, don't bust their cover. The moment you put this out in a big report, suddenly then they're going to have all the folks in their community rise up in opposition. But to me, that was kind of intriguing that we have some folks perhaps on the ground that are doing some really clever work here. So I want to put that there.
Put that down as collaboration with local successes.
Yeah.
Oh, Assad.
I wonder if there's a way to link the burden of disease in terms of dollars to counties or areas that don't immunize or have more hesitancy, and just put it in terms of like where folks understand where their tax dollars are being spent or where money is being spent in disease burden, linked to vaccine preventable diseases and how that impacts local economy and state economy.
Yeah, the cost of communicable disease and trying to clarify that at a local level. And it's complex, right? It could be a workforce issue. It could be a lot of different things. So yeah, I love that.
Well, and we saw that a lot during the pandemic. Just, unrelated, I think it became more public how that can affect the local economy, and local business owners saw it for the first time. So whether we're talking about COVID or not, we can kind of use some of that increased awareness and build on that.
So I'm going to bring up the most delicate conversation now, because I think it's important to know what we've done before and decide intentionally whether we're going to do it again. We've heard some interesting conversation today around non-medical exemptions. I will say, based on my initial conversations with legislators, there is not a high level of enthusiasm for revisiting what was tried in the past. So I think, I could see this group saying, we'll get back to that one, or trying to think about other strategies. Like, for instance, I know Boost Oregon did some really good work just trying to do some parental engagement at working with specific districts and specific schools, not to pass policies or mandates, but simply say, this is a school where there is definite risk of an outbreak because of lack of community immunity. What can we do in terms of education and engagement to try and navigate that? So that might be a way to come back to this topic. But there's also a lot of other stuff we could do. So I just want to kind of throw that out there and see if there are anybody that wanted to weigh in on that one.
Well, and I know there are definitely people in the room I've had conversations with about this particular topic, a few different people. And what Jessica, if you know Jessica, she's left because she's quite pregnant. But she and I have talked about this, and I think at this point, the attitude is leaning away from continuing efforts to eliminate non-medical exemptions. But the other side of that is that accessing those vaccinations should be easier than right now, getting a non-medical exemption is relatively easy. And there are opinions on both sides about making that more significant. But accessing the vaccine should be easier than getting an exemption. Just as a parent to small children, if all I have to do is fill out a form instead of make an appointment at the doctor's office, and the doctor's office is backed up because of COVID, and they're too young to take to a pharmacy or whatever the issue is, that is going to create a barrier, and I'm just going to sign off on the exemption and worry about it later. I'm not, but some people are. Mimi, here.
Yep. We commissioned a study to find out what we can from parents who are using non-medical exemptions. How much of that, sort of on a scale, is related to access? We assume that it's a little of both. We know that if you don't have access to vaccine, you have to have a heck of a lot of confidence in finding how to get one in Oregon, in lots of places. So we commissioned the study. Our pilot launches Tuesday. We're hoping to have enough data to inform the conversation by the end of the year.
That sounds like a great way to put a pause in this conversation, and maybe we'll learn more. But I just want to make sure that, because this has been a past priority, that we are not overlooking it. But that seems to me like let's revisit at some point in the future and see if we have any other brilliant ideas.
I'll pass it to North, and then we have some virtual comments also.
So I'm not advocating one way or the other. I'm just saying, based on experience in Colorado, where they tried to tighten the exemption process, so make it harder to obtain a non-medical exemption, they had the exact same fight that they've had in other states about removing non-medical exemptions. And so it would be a major battle to bring that tightening of the process, where you'll have major anti-vaccine celebrities showing up. There were death threats in Colorado just on making the exemption process tighter. There were people, walking and chalking elected officials' driveways, knocking on doors, saying, "You're trying to ruin my kids' lives." So I would advise that unless you're ready for a full-on fight, tightening those would be a challenge. I'm not saying you shouldn't do it. I'm just saying it's a major battle whether you do either.
Yeah, I think there's a lot of political considerations for not going there right now. And we have some online comments.
We have some online comments. And Tristan, could you go put some notes up while I'm talking? So Jay Huang from the Clatsop County Department of Public Health, back to the local health department. There's a bit of a lag with the stream, so that's why we're seeing these a little after the conversation. Local health departments is a place to go to get school vaccines for kids. Monthly competition and small incentive based on state vaccine data system improved vaccination rates at the clinic level. So monthly competition with very small incentives that come with it. I'm competitive, I speak that language. The incentives do not need to be large, like free passes to state parks or even just a coffee cake. And then, she also said, make the exemption not easy if we can't legally remove non-medical exemption. And I think what my point was, make accessing vaccines easier, not necessarily make the exemption process harder, although I'm not opposed. No. And then Dan.
So, whoever made those comments are spot on. There's no political appetite for anything that I think restricts, in quotation, restricting, whether that's making the exemption process more challenging or whatnot. I think there probably is political appetite for incentivizing. I love that phrasing and terminology, and increasing access. One of the things back in 2019 that we had going for us that we will not have going forward is, besides the fact that we were coming off of a measles outbreak in the Portland area, we had two political leaders on both sides of the building who made this their number one issue. On the House side, we had Representative Mitch Greenlick, who passed away during the pandemic. He was the chair of the healthcare committee, and Speaker Kotek at that time listened to him extensively on healthcare issues and pretty much just let him run his show. And so he made this a priority. And then Senator at the time, Steiner now, OHSU physician, which I think a lot of us have worked with at one time or the other on the Senate side. And she has just officially announced that she is going to be running for another office and leaving the legislature. So we will no longer have her ability to influence our colleagues in the caucus. We also had one, potentially two Republicans who were open to the idea of voting in support of the bill. And I honestly don't think you could get a single Republican in the building right now probably to vote for it. So those are some of the political headwinds. I would love to take a swing at it in the future, but I love the idea of focusing on increasing access and reducing barriers to the vaccine. What's that?
Does Steiner have to give up her seat to run?
Yeah, she's midterm. Yeah, so she gets a free run. But I feel like she's going to win. I'd put money on her. I'll say that. So we have a gap over here. It happens in policymaking in Oregon a little too much. I want to invite if we have ideas around community and culturally specific. And I also want to acknowledge that, I think there is some direct connection here. I think one thing that our county health partners have done a really great job is trying to build those relationships with CBOs, particularly COVID, for all of its disasters, provided a lot of resources to help build those collaboration. So I think there are some equity adjacent or directly relevant policies on the idea, but if we did want to identify any kind of community or population specific strategies, that's why I asked that question earlier about kind of tribal communities and tribal health delivery. And that could be an area to be filled in soon, and we could do more work there. But if folks had thoughts on that, would love to put those in the conversation now so we can start developing those. And I think we've had some specific advocacy partners joining at times in the conversation. I know some of them had to drop off, but if there are ideas we want to put out there today, we'd love to get those up too.
Yeah, I mean, one of the things I think you're spot on from an equity standpoint, we need tribal representation. When we tried to pass not necessarily the 2019 bill, but we had a conversation about producing something in the 2020 legislative session. And there was an increased focus on equity, which is great. But what we found was that we hadn't done the groundwork, and nobody had really, about outreach to certain communities around vaccines. And we saw a reduced uptake in certain populations, and primarily among them tribal populations, African American, Latinx. And so tribal representation is going to be huge. And of course, any kind of outreach into those communities is going to be different than what we'll do in downtown Salem. So,
yeah, absolutely.
I just want to add that maybe thinking about utilizing the faith-based community as a partner alongside CBOs and local public health might be a good way to go moving forward as well.
Yeah, I have this crazy idea. I would love to run a pilot project in Josephine County where we try to build some collaboration between the faith communities there and local pediatricians. Something as even as low key as like, hey, do you have like a parents' day at church, and can we have someone come in and have an initial conversation with you? It sounds like there were some efforts that were done in Jackson and Josephine County in the past that might be restarted again. But to me, that's a really intriguing piece. I know that we focus a lot on BIPOC communities, and that's certainly needed because of historical neglect. But I don't think you can walk in this space and recognize that certain faith communities are another major gap that we have when it comes to utilization rates. So I think that's great. Yeah. Yeah. And if there's collaboration there, even better, right? Yeah. Other ideas. And how are we doing on time?
We've got about 3 minutes left in the session, then there's supposed to be a report back or just informal
Yeah.
discussion.
I think we're going to let you all break out and discuss these among yourselves, which you should feel free to do, or to use the restroom, whatever you feel most inspired to do.
Yeah, Jim.
Another question. I'm doing my best to brainstorm. Could there be a role in especially rural communities for other public officials? Like I'm thinking specifically first responders, like in an area of Eastern Oregon or something that a firefighter could give you an MMR shot or something. I don't know.
So you're saying just wait until someone's comatose and then give them.
Sure. Narcan and then MRR.
Are you asking if a paramedic can administer vaccine?
I'm saying, would that be a thing that would be helpful in certain communities?
It was undeniably incredibly helpful, in fact, life-saving during COVID. Oh, now all of those freedoms are gone. So we're back to pre-pandemic rules and laws and policies. But yes, it happened so many times. We had so many community paramedics and ambulance companies and volunteer firefighters carrying COVID vaccine to communities, to people's houses. Yeah, phenomenal, amazing. Kind of what you're thinking about.
Yeah, we got to get creative here.
Well, and outside of a state of emergency, wouldn't it be fun to have a school clinic that a firefighter gives your kid a vaccine at? My kid would love that.
And you get to ride the fire engine afterwards.
So what about like a 3 to 4 year legislative strategy? We're talking about what can we pass this next session? Each legislator only has 2 priority bills. Why not think about the 2024 election cycle, identifying candidates, educating them, and building your lawmakers into champions? Because if there's none that exist right now, like that's the opportunity. It's much different than a policy discussion and what can we change now, but what can you do on a campaign to win 4 years from now?
I heard there's a PAC that might be working on that. Word on the street is. Yes, publichealthpac.com. And I will just clarify, we are definitely looking at all this for the 25 session. So all that electoral work could happen leading into that. And I'll say even beyond flipping a seat or things like that, to me, there's an enormous opportunity, particularly with some of the partners that we have brought to this table, like the Oregon Nurses Association, that do a lot of electoral activity and fill out these things that they're the bane of my existence in my campaign practice called candidate surveys. Sometimes I call them ransom letters, but they give you a list of things that they want you to take positions on. And so I think even if it's not trying to flip a seat or something like that, there's a lot of opportunity through electoral process. It's also a place where candidates and elected officials are more accessible. They know they have to go out in the community, secure support for their election. That coffee, that town hall, those are all great opportunities to engage them and say, hey, I want to ask you about next session. Here's some things we're thinking about. I'd like to get your take on it. So I think there are some ways to dovetail that activities, even for non-political action committees. So I'd look forward to that as well.
And we do have some comments on the virtual regarding tribal communities.
Oh, wow.
Nadalyn Begay says, as a tribal member, there are very valid concerns that families in our communities have shared about the intersections of historical trauma and vaccine hesitancy, again, providing resources and training. As someone said before, there's good work being done around vaccinations in tribal communities, including urban communities. And Representative Tana Sanchez is also a great ally. She's an Oregon tribal member too. And she was at our panel legislative kind of reverse town hall in February, and she spoke very eloquently about some of the challenges that legislators are facing.
Yeah, and I think that can be, and this will go into our next session, that can be an area of work that we're doing over the next few months. I think we need to intentionally engage each recognized tribe, but then also spend some time with the nonprofits that work with urban and other Native populations. And we've had some really great partners showing up to these conversations already, so I feel like we already have some really good opportunities here.
And then Jay Huang says, if talking politically, is there any opportunity to renewal scoria contract in public health? I don't know what that means.
Can you clarify?
Well,
Yeah. I wonder if that relates to the public health modernization conversation.
I'm not familiar with that term.
Okay.
I'll follow up with him.
Okay.
Yeah, we can follow up. And I'll say, because I want to recognize them for showing up, there was a really amazing effort put forward in the last session that builds on previous work that's been happening both through OHA and public health departments and partners to kind of revitalize our public health system around the state. And I think they got some important progress done in this session, but I know that work's not done. And that goes beyond immunization. It's a much larger conversation about all aspects of public health. So I expect there'll be an active dialogue happening between whatever work we're doing and that work, and would really want to be supportive of that, because obviously, as we've heard, capacity and resources frequently becomes the limiting factor here. And we certainly don't want to get in a dynamic where we're pushing public health departments to focus on this to the exclusion of something else. So I think that's a really important part to hold as we go forward. Anything else?
No, but
Yeah.
it's probably about time to take
Yeah.
about a 5-minute break. When we come back, it's really about who you like better, me or Jake. No, I'm just joking. Over here in this room, we will have, and you know what? I have a slide advancer somewhere. Here we go. In this room, we're going to continue this conversation and talk about collaborative policy development. Based on who's in this room, this is probably the place for you. But if you are interested, I am also running an Advocacy 101 breakout in the Thornton drawing room. That's right where the registration table was. It's really, if you haven't engaged in a lot of advocacy, or even if you have, but you might not have engaged in a lot of advocacy personally, let's say you do it more for work, but are interested in becoming more of an advocate in your free time, I've got a pretty decent session in there that will help you get started. So it really is a 101. So again, if you're a seasoned professional, it might be boring. You'll want to stay here for collaborative policy development. But we'll let you go, and we'll meet you back at about 3 o'clock.
What do the streaming people do?
The streaming people have to stay here. I'm recording my breakout session, and they can watch it later. They also have the materials on the Whova app, so if they want to do it on their own, I guess they can, but I'm pretty fun, so.
I will say, if you stick around here, the odds you're going to get some homework are dramatically higher than if you go to the Advocacy 101 session.
Yeah, but we have classwork in the other ones. So.
departed for things they had to do. So I'm not sure we're going to need the full breakout today. So I think what I would like to do is the goal today was to take, or this session was to take all of these ideas and then build out some details, next steps under this. And I think, as we mentioned earlier, the first step would be essentially, where do we need to gather research, data, background to kind of be better informed in each of these areas? And so, that's our job. Our job is to kind of facilitate and lead this legislative agenda into fruition. But if there are areas that stand out here that people have interest or expertise in, whether they wanted to, like I said, take some homework assignments or say, hey, I'd like to have a follow-up conversation about that. I'd like to just take this conversation today, and certainly our partners online, to kind of capture that. And then we can take those as follow-up steps for everybody. So like I said, we could probably get this done in about 15, 20 minutes. Or more, maybe, depending on where it goes. But just want to kind of throw it out there. It sounds like it's probably worth having a conversation with the pharmacist about some of that infrastructure questions. That's a big deal.
I was just gonna say, into that, there's, pharmacy has its issues, and being able to help you guys understand those issues to help guide advocacy, whatever we can do, let us know.
That'd be great, yeah. And I think just understanding kind of the state of play and operations questions for everybody is a really good foundational piece. So we'll get that conversation done. As I mentioned, I think that the tribal and Native community engagement would be a really critical piece to add here. I'm happy to kind of lead that work. And I know that will require some time and intentionality. And I did have a good conversation with the OHA folks before they departed about kind of the appropriate ways for us to be doing our advocacy preparation, but then also be kind of talking to them and gathering what we can in terms of the information and the background that they can provide on these issues. Are there other areas, though, that people feel like they have insights or recommendations? Yes.
Community health workers, because there are very favorable policies in Oregon recognizing community health workers through the Medicaid program. So I don't know if there are any particular projects. I know in some of the other states I've worked in, even with ACS, they've done these great echo projects. I know in Texas and in Nevada, they're doing one around HPV. But really extensive education around the vaccines, and then that community outreach piece. And then that follow-up and measurement. In California, I know with some of the health plans, they employ community health workers, and they've done some outreach in communities and then did additional follow-up to bring those patients back in, to get their second or third dose, or to just even catch up on vaccines. So I think they can play a very important role, even referral to providers that, so they can educate around access, since a lot of the patients don't know where to go to get their vaccines sometimes. So that could be one way too, since we already do have favorable policies in Oregon already. So consider as a community health worker role.
Gotcha. And is that, I'll let you get the microphone, is that something that there's a trade association for, or what would be the best way to kind of,
there is an organization, Association of Community Health Workers. I can't remember the specific name in Oregon, but they do have a pretty large organization.
Great. Jamie, is that something you guys have done at all here in Oregon with that kind of engagement?
It's not something that we're actively doing, but I mean, yes, we work with the community health workers in some capacity just for relationships, and the broader ACS side of the equation. I'm on the advocacy side of ACS, so it's harder to know where some of those community relationships are. But we do have existing relationships in hospital systems and community, CBOs all across the state. But it's not a top thing we've been working on.
Gotcha. Well, maybe point us in the right direction. Like, go get them. Yeah. And I think, and I said, and this, if someone has figured out how to crack the CCO code, please let me know, because I think we've really seen them as a
as I mentioned, both they have a self-interest because of the Medicaid performance data, but because the populations they're working with obviously are where we see underutilization and barriers to access. I think that's a big priority for us, and we'll probably have to take some time and find some strategic partners in that space that then can introduce us to the broader community as well.
So one of the things you talked about was the EMT paramedic outreach. I knew that I had heard this on OPB. I'm looking at a broadcast, and I'll send it to you, Jake. Friday, September 8th, how community paramedics in Oregon fill the gaps in care and reduce visits to emergency departments. Talks more about medical management and referrals, but I think there's a model that's already started, and it particularly focuses on the Hermiston Herald profile, the community paramedic from Umatilla County Fire District 1, and her job of taking care of patients to avoid trips to the ER. So.
Oh, interesting.
Yeah. So the conversation started, and it seems like it's a good fit for vaccines too.
Okay. Yeah. Please send them my way. I love that. I think this misinformation stuff, I think we're going to have to look to some national partners and other models around the country for that. I also feel like there is a fair amount of work that happened, centralized at OHA, but then with a lot of decentralized partners around COVID. So we will have to try and go recover some of that information. And that'll be interesting to figure out that. I want to ask if there's any suggestions on faith-based community, because I think we've had a couple representatives show up to previous presentations, but my sense is that there's not an easy kind of organizing opportunity in that space. And unless we're going to go to specific congregations or particular churches, that's going to be a slow grind. And not that we can't do that. I just didn't know if people had more clever ways to try and do that types of engagement.
Ecumenical ministry.
Yes, we've engaged them a bit on this. I also say I don't think that they would disagree that some of the faith communities with the highest levels of vaccine hesitancy are probably not the ones that they engage as much. Not that that doesn't mean that they're not in a better position to start the conversation than we are.
We also have some online chat.
Oh, wonderful.
Natalie Legay suggests ORCHWA. The executive director is Janine Smart. It's the Oregon Community Health Workers Association.
There we go. That's fantastic. Thank you, Natalie. That was it?
That was it.
Okay. I was hoping that there'd be a lot, but that's really valuable, so thank you. In terms of the other stuff here, I mean, I guess, and I know we've lost our Oregon Medical Association representatives, this would be a question. In terms of the scope of practice or regulatory enforcement, I don't know if folks, or continuing medical education, has anybody done work in this space or has thoughts about kind of the best way to approach that conversation? And this is probably just going back to those professional associations and trying to understand from them. Okay. Anything else? Like I said, I knew we were kind of running out of steam, so I wanted to be conscious of that. Anything else that people want to try and take off as a action item here for policy development? Okay.
I have a request.
Absolutely.
And it may not be a short-term thing, but North touched on it about going to town halls and constituent coffees and even political fundraisers, because I go to a lot of town halls and never is public health. Jim, the doc, who was here earlier, he's a reliable one in Northeast Portland to talk about public health, but nobody talks about it in other places. And I frequently go because nobody's talking about education, which is profound to me. So it seems like we could make a short prompt kit and maybe a postcard that folks could take to those constituent coffees and such, and just start those conversations. Because as I said to you during the break, those indicators of all that downturn on vaccination, that's a big deal. And I know the parent community has no sense of that. because we haven't had an outbreak yet.
Yeah.
But so I think there's some opportunities there, short and long run, to raise with current legislators who aren't tracking that stuff. And I think it could be done in a fairly soft way. And here's a link, or here's who could follow up, or strategize with the folks who are going. And I'd be happy to carry some to the places that I go. So
I'd love to, have more conversations about that. And I think that is one of the goals for the Oregon Families for Vaccination, is that will be kind of the grassroots complement to all of us experts and association and staffers, is to have kind of that popular base of support. So I think that's a great way that we'll be looking to build in some work for them to do, and movement building work. So we'd love to collaborate with you on that. That'd be awesome.
And Jay Wong on the chat also mentions that as a policy, we need to work on building a stable funding mechanism as well.
Absolutely, yeah. And I think that references the conversation around modernization that we touched on a little bit earlier. And I'm really looking forward to kind of it was really great to have Sarah show up today. And so figuring out how to kind of align and have these be complementary efforts, because I think there's a reason we put money over here, and we certainly left it as part of the equation, is because, we can ask everybody to do more, but I think that's the classic flaw in Oregon, is we'll just keep stacking more things on and ask you to do it with the money you've got. And that doesn't work. Yeah, surprisingly, I think we figured that out. All right. I'm going to let us adjourn, because I think we've done a lot. And I will say, I think, as I mentioned earlier, my expectation is that 90 to 95% of this is on us. We're going to try and take everything we've talked about today and synthesize it into a work plan that lays out some next steps and a timeline and makes it easy to participate and be involved and collaborate. So I'd ask everyone to wait for that. But if you have things in the meantime, feel free to reach out. Or if there are things we haven't captured as ideas or opportunities, would love to hear that. This really is a chance to kind of work through a lot of different potential areas. And I'll say it's kind of exciting to me. I assumed when we started this space that I'd just find the top 10 policy interventions in the vaccine space, and we'd just jump into picking some of those. But to do some ground up policymaking that fits what's the need here in Oregon, I think is in an ideal world how it should be done. And it just doesn't happen a lot. So I'll let everyone take a little break. We will have a brief wrap up. And then if you just can't get enough, we'll be having a little bit of a reception afterwards. Is it, Tristan, is on site here? Remember?
Agenda says offsite.
But my understanding is that it's in that room where Meg's breakout is meeting right now.
Okay, so don't.
Maybe it's,
yeah.
The after hours reception, drinks, offsite?
Offsite.
It says on paper.
Well, it's offsite, but maybe just across the way. Point being, if you've reached a point where you could use a alcoholic or non-alcoholic beverage to digest what we've done today, we have a solution for you. And if you're online, I encourage you to go to your fridge and do that for yourself. I empower you. So let's take a little break and we'll let the advocacy team catch up, and then we'll finish up for today. Thanks, guys.